The Westborough Board of Health would like to call their meeting to order. We are doing a hybrid meeting tonight, and pursuant to Chapter 20 of the Acts of 2021, this meeting will be conducted in person and via remote means in accordance with applicable law. This means that members of the public body, as well as members of the public, may access this meeting in person or via virtual means. In-person attendance will be at the meeting location listed above, and it is possible that any or all members of the public body may attend remotely, with in-person attendance consisting of members of the public. We may limit the number of people that can come in through the Google Meet because we're still working on some audio issues and how to restrict people from interrupting the meeting. But when required by law or allowed by the chair, persons wishing to provide public comment or otherwise participate in the meeting may do so by in-person attendance or by accessing the meeting remotely as noted above. Additionally, the meeting will be broadcast live in real time via Westborough on local cable TV or by westboroughtv.org, Verizon Channel 28, and Charter Channel 192, and also online through westboroughTV.org and youtube.com/westboroughTV. So we had scheduled on the agenda a meeting with the school committee, and I think Amber Bach and the chair of the school committee is here tonight. And then also on the agenda tonight, we have a joint meeting with the select board that was invited to join us, and I believe that the board is going to be attending that as well. Let's see, if you are attending the meeting in person, we ask that we please follow the CDC mask wearing guidelines, which I believe is that if you are in a public building, right? We're supposed to be wearing a mask?
Only if you're unvaccinated.
Only if you're unvaccinated. Okay, so anyone who is unvaccinated, or if you wish to wear a mask, you're allowed to wear a mask.
Or if you're in an area of high transmission risk.
And I believe that Worcester County is considered by the CDC a high transmission risk.
So Worcester County is currently, that's one of the issues I want to bring up because it's a big county.
It is. That includes a very diverse set of towns and cities. So maybe we will hold off on that until we actually discuss that during the meeting. So let's see, as far as the agenda tonight, I think our goal was to try to have the preliminary discussion about the school board about the school year coming up with COVID regulations at 5:45. So we've got about 5 minutes before that begins. I was hoping we'd get through some regular Board of Health business before that happens. The first item on the agenda would be the minutes from last month. Did anybody have any issues with that?
I move we accept the minutes from the July 2021 meeting as submitted.
I second that.
All in favor? Aye. Let's see, the interim director sanitarians report. I had a couple of questions about the Berkshire Bank with the finding of needles on the property, and was wondering, as far as the Board of Health, we just helping them deal with the sharps cleanup? Is there any other activity that we're doing in terms of the Board of Health?
No, they had called me, they had already cleaned it up, and
Okay.
they just wanted to make me aware. It's right on Route 9, it's the old Friendlies and everything, it's over in front of Walmart. Friendlies was like 20 years ago, but
We
but
know.
that's the building. It was down by the street. Their landscapers found it. They put it in a bucket and threw it away. I told them you can't do that. You have to contact us. We'll find a way to get rid of it. So they just wanted to make us aware. I told them if they found it again to let me know. I will go out there and dispose of it properly.
Okay. And then we have a couple of properties that haven't been being maintained very well. I think it was Baylor Ave and Grove Street.
Yes.
What's our next step with those?
Baylor Ave is in land court with the town right now. The town, we have to wait till the 15th of August to find out. The treasurer will let us know
Okay.
what's going on with that.
Does that require you to go into court, or?
No,
Okay.
no. That's the land court, what it means is they're gonna take it for taxes.
Yep.
The woman died 7 or 8 years ago, and the house has been empty, and I think they've reached out to family. The family is very elderly. One, from what I was told, one is in a senior living facility in Arizona, one's in Florida. And it's just, it belongs to them, but no one's answering the calls, so we can't go on the property and do any work on the property. We can't cut the lawns, we can't do anything, so it's in land court right now. Once, it goes through land court, if the town is granted the land, then we'll do what we did at 7 Baylor, which is DPW went in there, cut everything down, and then they put it up for sale and sold it to pay the taxes. And
Okay.
I'm not exactly sure how that works, that's through the town manager's office, but that's what that one is. The other one
It's Grove
is
Street.
the corner of Grove and I believe it's Church. The house was bought by a developer, and I don't know if during COVID they ran out of money or something, but if you go down, you see the weeds are 4 feet tall in the front yard, the windows are missing. I've sent a letter, it came back today, undeliverable, even though I sent it certified mail. Bill in the building department has a phone number. When Bill gets back from paternity leave, and we'll be able to contact that person. He has a number for the person in Florida who is the owner.
Okay.
When you say you sent it certified and it was undeliverable,
Yeah.
does that mean nobody,
Nobody picked it up.
you know, it's interesting, because sometimes in medicine, we'll send it both certified and uncertified. And if the uncertified one doesn't come back, there's at least some implication they got it.
Yeah. So we, it's in the past, we've always sent it one way. I'm gonna drop it in the mail the regular way
Yeah.
next and see,
See what
and send it certified again
Yeah.
and see if we get one of them. From what I've been told from the building department is that the owner of the company has been in Florida for the last 6 months, so we don't know if there's anybody in her offices or whatever. So that's, we're working on. I know the neighborhood is upset, and that's one thing that, we're gonna try and bring up a nuisance housing regulation, maybe in the Springtown meeting and do a bylaw.
Okay.
So that way we actually have some teeth that we can go into this and have money to do the work ourselves and then lien the property. But that's something that we're gonna look into. The new director has a couple of ideas on that, and we'll go into that.
Do either of you have anything else? I guess the one other thing is maybe to comment on the scam that seems to be going around with the pool operators.
Oh, yeah, so-
Just to kind of bring it to public
Yeah,
attention.
it was just for my pools out there, we had a gentleman who was complaining about pools, wanting me to go in and shut them down, wanted me to go in and write them up. Found out that he runs his own pool management company, and these places had already turned him away for his services. And I think this was a way for him to say, hey, look, the Board of Health shut you down, I can take care of that for you. So, because some of the stuff he was saying, like, he doesn't know that we have variances.
Yeah.
And he was, talking about the variance, say, oh, they can't do this. I said, well, actually, they can. And after talking to all the places, he had contacted each and every one of them and tried to get a job, and they didn't hire him. So I think that's what that was all about.
Good. Thank you, Ray.
I move we accept the, I'm sorry, did you have something you were gonna bring up?
Nope.
I move we accept the interim director's report for July as presented.
I second.
All in favor?
Aye.
Aye. It's 5:45. I'd like to move now to the attention of the schools here in town. I had a couple of things that I just wanted to summarize, if that's okay.
Please.
So at the last Board of Health meeting, we had kind of set a very minimum standard that masking for unvaccinated students, and that we were going to see at this meeting whether to expand or reduce or change that initial guidance. We've asked the school board to attend this meeting, and I think that Amber Bach, as I had said earlier, and the chair of the school board is here with us tonight. And then as far as kind of the way these things go into effect, at the US level, there are certain things that the US government says have to happen, things like transportation, you have to wear masks, so that would include public school buses, and so I think everybody's guidance kind of inherits from the top down. The CDC is not issuing any mandates, but they are recommending masks in schools. They're recommending masks in indoor public places for everyone in areas of high or substantial risk, which does include Worcester County. The Massachusetts governor has not issued any statewide mask mandate. He believes that each community is different and up to the local communities. The DPH and DESE, their really top priority is that schools be open 5 days a week and that they do not have virtual learning. Secondarily, the vaccinations, ventilations, hand washing, and social distancing are consistently mentioned by them. And that anyone unvaccinated must wear masks, socially distance when possible. Their guidance is that vaccinated students don't need masks. Outdoors and while eating, masks are not needed. And anyone in the nurse's office must wear a mask. And it's a kind of a broad summary. We can go into more details in just a bit. And that the American Academy of Pediatrics is in favor of masks in schools. And then layered on top of that, the Board of Health gets to make rules. We can't really violate anybody that's made a requirement above us. And then below us, the school board can take any sort of stuff that we don't have mandates about and can go further on any of these issues as well. I do have a summary of kind of some of the other towns and what policies they've put into place. And I think that you've got some update on statistics, Alan. I don't know if you want to go into that before or after kind of summary about the rules.
Why don't we go over the rules?
Okay, so just a couple of comparators. I think in this past week has been busy with a lot of the local boards of health. And so this might not be a comprehensive list. But Belmont has issued masks being required for everyone 2+ in indoor public spaces, except for medical or disability, and for diners while they're sitting or eating. And they have guidance that this lasts until Middlesex County, which they're in, is rated as low or moderate for 2 consecutive weeks. Lexington has a policy that's a little bit more detailed. Masks indoors, except when working by oneself in a cubicle. No masks or no physical distancing when outdoors, 6-foot spacing while eating, and vaccinations are required by the staff. Amherst, Boston, Salem, Springfield, masks are all required in public schools. Arlington, Brockton, Revere, Wellfleet, masks are required in all municipal buildings. Nantucket, Provincetown, masks are required in public businesses and houses of worship. So it kind of gives us a sense as to where some of the other communities in Massachusetts are. There's a lot of communities I didn't mention, and those either don't have any sort of mandate or I'm just not aware of the mandate.
Yeah, I'd like to just comment on that
Please.
list. One thing that's notable on that list is many of them are more urban areas that have lower vaccination rates, and then you have out Wellfleet and Provincetown where they recently had a large outbreak. I have a colleague who is on the Board of Health in Provincetown and was visiting with her this past weekend and got some insights into some of their thinking, but they are still having a very high positivity rate. I think the positivity rate is currently around 7%. So
I think that's a great segue if you'd like to talk a little bit about Westborough's numbers
yeah,
and how we differ, especially
mean,
from some of these.
maybe Ray wants to start on that,
Okay,
and then I'll supplement.
Ray, why don't you go ahead?
Okay, so, as people know, we used to do weekly reports. When the numbers went low, the board said we could do monthly reports until we got more than 10 a week. Since July 29th of this year, we've had 14 total cases up until noontime today. That's when I did the cutoff today, was at noontime. So we had 14 cases in the last 11, 12 days. Of those cases, 9 female, 4 male. 1 between the ages of 0 to 9, 2, 10 to 19, 20 to 29, there was 2, 30 to 39, there was 3, 40 to 49 was 2, 50 to 59, 2, 70 to 79, 1, and over 80 was 1. So percentages, what we were looking at is I had sent this out earlier in the week. I don't think it might not have been part of the packet. If anybody, it's the one with the yellow.
Yep.
So our numbers for vaccinations, 0 to 12, nobody can be vaxxed at this point in time. 12 to 15-year-olds were higher than 95%. 16 to 19-year-olds were higher than 95. Actually, every age group except 20 to 29-year-olds, and that's it. Everybody else is above 95%. So when you take all the numbers together, the town of Westborough is 89% vaccinated, with another 8% being partially vaccinated.
However,
Yes.
those numbers are based on 2018 census, and so the numbers are not adding up completely, because it's obvious
Nope.
that we're
And
missing,
that's
we're
why-
missing numbers.
I did note, so the 16 and 19-year-olds, you have almost a 300 person changeover, but that could be the kids aging into that group, some maybe less aged out. I'm just using state numbers because we don't have all those numbers, and the state has the fully vaccination. I'd have to go through every person's address to find who's vaccinated, who's not.
Right. Although if you know ages by, vaccinations by age, the school department probably has a pretty good handle on the number of kids in
And then we-
that age group.
and then we
So
have
might
some-
be able to mesh these numbers together.
We could, and then there's some kids who don't go to school in town, so there is always gonna be
Some.
differences in the
Yes,
numbers.
It might be closer than the 2018 number.
Yep.
though.
Yep, I just, with everything else going in the office, I just did the best numbers I could with what I had.
Absolutely.
And these are numbers the state's been using, and and these are their numbers, and our numbers were very close with everything else. One of the other, I'm trying to think where I put the other numbers. I had written notes. So out of the group of, persons who I have the 14 cases, it's actually on the back of the sheet. So 4 of the 14 cases we have are probable cases, which the state does not count as positive. We've always counted them as positive, so we have 4 cases of those. One of those cases actually retested 48 hours later twice with PCR negatives. He was tested out of state at a camp. He get him AG test, came out positive. They shipped him home, but he didn't get tested within the 24-hour period that the state requires. So he's considered a positive case, even though he has no symptoms, nothing else, and he's been tested twice since for PCR with nothing. 4 of the cases were unvaccinated adults. 3 of the cases were in-home transmission. The husband had it, gave it to the wife, mother gave it to a child, sibling to a sibling. And multiple cases where they commented that they had been traveling in the last 2 weeks. I think it was more than half were by plane. And that's really about, there's been no more hospitalizations and no more deaths. And the ones who have been positive, their symptoms are very mild.
And I do want to say that we've had quite a number of people in town write into us. I'm sure that the school board has had a number of people writing into them as well. We have read the emails that have come in. We've read the texts that have come in. We appreciate feedback. I don't think at this time we're going to allow tons of public comment. And based on the number of emails that we got, I'm not sure it makes sense to read through them all. But the general sense is that there are 2 groups of people. One group of people that was very much in favor of wearing masks in the schools at all ages. There was another major group that were, against the requiring of masks at especially the higher age groups, and wanting to kind of make sure that we have an approach that's targeted for each specific group with their unique circumstances, being that some kids can get vaccinated and some can't. And there were some, I think, concerns overall about how well we have an exit strategy for if we put a restriction in place, when do we actually lift that restriction? To just provide some planning and transparency for people as well.
Yeah, and I think it works in the other direction as well. If we don't have a restriction in place, what might be a trigger to say we need to relook at things and take more, a stronger action, whatever action or restriction that might be.
And I do want to just go through a couple. I have a few concerns that people wanted me to raise, and so I think I'll do that at this point. That masks for unvaccinated people, if we had a rule that was requiring just that, people were concerned that people might not follow the rule, and that it's actually really hard to track and monitor and make sure that that rule is followed. Another concern we had was that the Delta variant of the coronavirus does present risks to children, and that it's more so than prior coronaviruses, but it is less risk than to unvaccinated adults. I think that was the general concern that people wanted presented. I don't know, Alan, if you're shaking your head like.
No, I'm shaking my head because I just got a text that says, you need to talk into the microphone better.
Okay, we'll try that. Sorry
So
about
I
that, folks.
apologize for that.
The masks, can muffle voices, making it harder to learn, and obviously harder to hear as well. That masks sometimes hinder nonverbal communication and social interactions, and these are particularly important in the schools. And that whatever we do decide, or the school decides to do with lunches, that lunch was really important to the students, and to make sure that they could get a full meal in while they were at school. And then there were a couple of myths that I just want to, explicitly state and contradict. And that's that schools are unsafe. Actually, schools are very safe. Another myth is that vaccinations don't work, and that's why we're looking at mask mandates. And that's another thing that's just not true. Vaccinations work very well, both in reducing the spread and also keeping down the health complications associated with coronavirus. Another myth is that children are a high-risk population. And in general, across the board, kids represent one of the lower risks. It's just now the fact that they are in the unvaccinated group is why we're of particular concern right now. And the other myth that was brought up was that the emergency use authorization for the coronavirus vaccine means that vaccine is not safe, and that's not true either. The vaccine is very safe. It's been tested millions of times across the country, and we've got lots of data to support the safety of that vaccine.
So, I agree with all the things that you just presented there. Again, one of the things that I had made a comment to someone who had written in is that in this debate of masks versus no masks and other types of restrictions that might take place, everybody wants to point to the science and what does the science say about this and how does science justify their position. And there's a lot of science that is on both sides, and there's a lot more that just doesn't exist. And you can ask your question in a very precise way. You can say, how well do masks work? How well do masks work in a vaccinated population? How well do masks work in a pediatric population? How well do masks work in a school setting when you don't have social distancing? You could ask these things, and for most of these things, we don't have really great data. And so, for the most part, we try and be practical in what we think, how we think about these problems. We try not to throw caution to the wind. We try and take some type of a middle stance. And I think as we discuss this tonight, I just want people listening to understand that a lot of what we have to make decisions on is based on judgment and not necessarily data, because the data doesn't exist. And some of it is based on values, and values will differ from one person to another. So,
good, thank you. Did you want a chance to kind of talk on this a little bit before we then
Yeah,
get some feedback from the school?
I would like to. Wanted to thank everyone for being here and for all the incredibly hard work everyone's been doing. I certainly have been keeping up with all the current guidelines as they change week to week. I think some people didn't even realize the CDC changed their guideline as of last week. And initially, they were recommending K through 6 masking in school, and changed it as of last week to all of K through 12, and teachers full masking. We're all here to make the best decisions for our children and our community to stay safe, and also to do our share in stopping the spread of COVID. We should certainly applaud our town for our amazing vaccination rates, but we've also learned so much over the past year and a half. And the one of the main things we have learned, as Alan mentioned, we are certainly lacking data, is we have learned that in-person learning is incredibly important for our children. And that's something that we have to strive to keep kids in school as much as possible. And so how do we do that? And I think the American Academy of Pediatrics and the CDC, with their guidance of starting certainly the school year with full in-person masking, has that goal in mind to keep kids in school. And once you start the spread of a Delta variant within school, you're going to have kids out. You're going to contact trace. You're going to have kids out. So the American Academy of Pediatrics, as we mentioned on July 18th, that was their main goal, everything possible to keep students in person in school. And they also stated that it's vitally important to take all necessary measures to limit the community spread and keep schools open. And their main recommendations for implementation this, of course, are continuing to promote vaccination and then in-school masking. One thing that I'm sure is going to come up soon as we talk to the school committee and Amber more is the idea of asking schools to enforce masking policies, which has come up for unvaccinated students and teachers. And there has been concern raised by the AAP and CDC that this could put undue burden on our schools, on our teachers, on the teaching staff. And with the highly contagious Delta variant that is certainly not spreading among our community significantly right now, but is in other communities, and being 200 times more transmissible than the previous variant and more virulent. We are seeing vaccinated individuals with breakthrough infections all over the country. We are seeing people vaccinated with asymptomatic infections. So these are people that could certainly, spread the virus and make our children sick. So one thing we need to continue to think of is how to protect our children. On August 5th alone, there were 261 children admitted to U.S. hospitals. And we continue to see about 200 children a day admitted to U.S. hospitals. So a lot of people are saying kids don't get sick, they have mild virus, they have mild symptoms. Some kids get very sick. 94,000 children were infected in the past week. While COVID mortality in children is extremely low, morbidity and chronic symptoms are possible, and we're still learning with the Delta variant. We really have very limited data on this variant. Countries around the globe are seeing sicker children as well. The added benefit of masking is that it decreases other respiratory illnesses in schools, which will cause, less missed school time for our children.
You want to let the school jump in a little bit? We can have
I
that
think those are the main things I wanted to say. Sorry, thank you.
I'd just like to make
Yep,
a
sure.
couple comments in response. The one thing that I think came through in many of the letters, and it's something that I support, is the notion that it's hard for us to I think it's difficult to look at national data and have that guide what we're doing here, because the circumstances are so very different here. Our vaccination rate is so much higher than the rest of the country. It's higher than most of Massachusetts. And so knowing that, also if you look at the American Academy of Pediatrics statement, they're taking a national view. And often the CDC, at least to their credit, will say you have to look at what's your local risk. To me, the mistake the CDC made is looking at countywide data, that what is happening here in Westborough, Southborough, Northborough, Hopkinton, the towns that are adjacent to us, is really quite different than what's happening in, let's say Gardner or Leominster, places, relatively far from here. If you look at, for instance, the Cape Cod, all of Cape Cod is Barnstable County. And what's happening in Provincetown really doesn't impact directly what's happening in Falmouth in a substantial way. Obviously, people travel, people have exposure, but if there is substantial risk from that, then it will start showing up in our data. Now, the data that Ray presented is an uptick from what we've seen probably earlier in July, and that mirrors what is happening across the state. But what also is clear is that with a very large vaccinated population, the risks of what happens if you get infected are much different than when you have a substantially unvaccinated population. So I think we have to focus on what are the risks here as opposed to what's happening in Florida or Louisiana or other places where the attitude towards vaccination is very different.
Thank you, Alan. Thank you, Melissa. So Amber, you've been gracious to share a draft plan with the Board of Health that basically followed the DESI guidelines, but I wanted to give you an opportunity to kind of, or either of you, speak about, you know, what you see, what you would like to see to kind of help us, you know, especially if you've got information about how last year went, you know, what things were particularly difficult, what things you think that you've kind of got down and are perfect now, and you know you want to do again.
I want to, wait, say that again?
Actually, a lot of stuff did go well last year.
I agree, a lot of stuff did go well. So welcome back to our shared partnership. Who would have thought, you know, a year and a half ago that our two boards would be joined at the hip. So I appreciate with immense, you know, respect the range of discussion that you bring to these decisions. For us, I think the year was difficult and challenging emotionally and in complexity, but it was successful within the confines of what was capable of being achieved. Certainly, none of us want to be where we were, and I think while there are immense challenges still to be ironed out, as we're talking about here, we're in a very much better place and in a different place than we were this time last year. So that is a celebration where I think it's important for us to also give people a sense of perspective that, you know, we have taken steps forward, that there are positive trends across the nation in terms of stemming the complexities of illness that this disease was causing us in terms of a virus. So for where we are, a couple pieces. What I would like to do tonight is, Kristen and I are here, I just want to give you a picture. Your summary of a lot of the benchmark data presents very much the synopsis of what's in the linked documents from DPH and DSE. So thank you. It was very
Some
well
of it
done.
I stole from your
I
document,
know.
so thank you, Amber.
And so I think what we want to do is hit on a few high points and then talk through questions. You know, I think I met yesterday with our safety committee. They're watching. They know we view you as our medical expert team. You know, we know that we have the school committee. We have our leadership team. They're watching as well. We met today. I actually have 2 more days of leadership with them this week. So there's layers of meetings to follow this. And so your guidance tonight and your thoughts on opening really anchor the direction of our work. It's an immense responsibility for you to provide guidance to schools, and so I think it's important to understand all the layers of complexity. So I think it's good for us to surface them and to weigh each of them thoughtfully. So I think the majority of this centers on, if we take kind of an overarching view, if you look at the layout on masking. I mean, I think if you look at the kind of the hinge for what holds it all together, it really is this discussion around masking. The overall guidelines in terms of perspective is reducing distancing, returning to a range of normal practices, and really some of the to be decided, if you look at the range of your conversation, centers on masking, obviously. So that's where we'll put the majority of our time. I do think it's important to note that we're still waiting on DPH and DSE to put out some additional updates on contact tracing and quarantining guidelines, because as they've moved forward to create more typical schooling in terms of spacing, distancing, and interacting, while they also then have opportunities for differences in masking, they have old contact tracing guidelines while they're increasing the contact for students. So there's some pieces around those complexities that I think we're waiting on. I think all districts, again, districts that are coming out with really, really early guidance are gonna have to keep going back and amending. I think we obviously, you know, the practice of how we worked, we're gonna work it through, we're going to listen to the guidance, we're gonna get as close to the start of school where we can give people guidance. It's nothing like where we were last year in the sense that making these decisions was so essential, because literally we had to get things in place to open. This is pretty much a flip of the switch, which is pull your mask out of your bag, you know. So in the sense of the complexity in terms of like how close we get to the start, it's a little bit more flexible for us. So we'll talk about masking in just a second. I think the other is, again, the contact tracing and waiting on updated guidelines. There's a return towards school events of more typical nature. We're looking to, of course, get back to all of the things that create the cultural norms of schools. There's lots of special events that constitute schooling. And we'll have to take those, and in our document, you see I make a notation that those will be decided event by event based upon current status of guidelines. And I think you're talking about other municipal masking, and we fall under that guideline. So, you know, if you make some decisions, it'll cascade down to some of our public gathering pieces. If we're doing back to school night, sports orientation night, all of those types of things, you know, we anticipate basically using the protocol we used last year, which is make a set of parameters around hosting the event to release to people, confirm them with you, affirm that they're on track for guidelines that you feel meet the benchmarks, release that, and then implement. So that's a routine I see us continuing this year as we enter into the fall.
Yeah, I do see that, I mean, basically breaking it down to the masking and then some of these other events makes
Yeah.
a lot of sense, I think, in terms of how we approach it tonight, just to
Yeah,
kind of
I
make sure
think
that we
there's,
get through
and
all
I
of
think
this
the
stuff.
contact tracing pieces are really the part that will evolve, and that does have school-based impact for us. And again, I want to make sure that we're thoughtful tonight to talk through each of these and make sure that we're looking at them. I mean, I think the dispelling of the myths, as you talked about, are important as well. School was safe. We operated exceptionally successfully in this community, and vaccinations do work, and all the pieces that you've highlighted bring us into the school year in a good place. So the current recommendation as we stand is, you know, again, to my thinking, drawn from the perspectives of the discussions that we've had with you in the past. Should your board head in a different direction, obviously the work heads in a different direction. We've been in partnership. So from that standpoint, we've looked at the benchmark numbers, the data around illness and vaccination rates, and used that to make smart decisions at the building level, and it served us very well. We ended the school year with the guidance opportunity to have summer school masks optional for all students, and successfully conducted, we had 300 students in summer school programming, 4 days a week, 4.5 hours a day, 20 kids in classrooms, unmasked, playing outside, playing inside, with typical guidelines, and had 2 cases with no contact tracing issues.
Yeah, and overwhelmingly, the response that I had gotten about the summer program was that it went very well, that I don't think anybody wished that it had been done differently, and I think everyone was in favor of, you know, the way it happened.
Yeah, definitely. It's a data point as well, and so I hold it up as such, because that's what we have to ground all of this in, which is how are we doing, what are we seeing in Westborough-based students and illness when they are together, masked and unmasked, and what does it tell us about how to open the school year? So I had another 200 students in additional summer programming successfully with no case transmissions or outbreaks, and they were unmasked by option. And again, the flexibility of the environment worked effectively for students, which is, you talked about one of your points being enforcing masking guidelines. I think the culture of the schools is we support everyone's choice, and around those students, those were younger students, so none of them are vaccinated, and they all made their selective choices, some of them masking all day and others not. And that was, I think, universally comfortable across the programming for students as they were together. So these are the aspects of data points for me. 1, how did summer programming go? What was the data? 2, what are your data points and the vaccination rate that would help us? 3, what is the educational complexity we need to face? There are issues around educational implementation that are different and unique to schools that I think it's important we take into consideration. It is exceptionally hard to teach children how to read, how to do speech and language pathology, how to conduct instructional teaching when you're across a room and you're trying to project your voice several hours a day with a mask on. Certainly as medical professionals, you understand masking at a high level, so I'm speaking to people who certainly manage this. But running a lecture, standing up front and teaching and projecting your voice all day is exhausting, even when you're not in a mask, and very difficult when you are masked. Additionally, it is very difficult to hear, understand, and interact with young children of tiny little voices and tiny little voice boxes in a classroom when you're trying to hear what they're saying and so that they can hear what each other is saying. So we're trying to picture the opportunity to keep people safe and the balances of those tensions while recognizing. And I'm not saying that that's an argument not to mask. Right now, the current guideline is that pre-K to 6 have to be masked anyway, so we will certainly manage that. But it's not easy. And I think from that standpoint, it's a piece of data. I think it's important to put on record that that weighs into decision-making.
No, thank you. I think that
Yeah.
that's important to hear from you guys as far as what is, important and what difficulties you face, so.
Yeah, I just want to clarify something you said at the very end there. I think these issues around the downsides of masks are in fact arguments against masking. The issue is not are they arguments against masking, but do those arguments outweigh
Exactly.
the risks of transmission? But I
Right.
think, for a balanced discussion, we need to understand the pros and cons as affects each particular age group, because obviously there's less risk when someone's vaccinated, and there's, more educational needs at younger ages, and
Right.
those things are in conflict with one another.
And no, point well made, and please know that I'm not offering it as an argument to mask or not mask. I think it's a point of
Yep.
data, and we
Yep.
put them all out there, and we use them to weigh those balances, and I leave that to you to weigh. It's more complex with young learners. They're harder to hear, and they have littler voices, but they have to be masked anyway. So even if we adopt and move forward with DPH's guidelines based upon where we are in Westborough and monitor moving forward as a partnership, they'll still be masked anyway. So I don't see that changing in trajectory until we see their vaccination options come to fruition or the trajectory of illness change radically, and your advice will guide what we do. So I think in partnership, we're not in very dissimilar places.
Yeah, So
You know-
I see masking as kind of a layered approach, right? Where we have the vaccinations, we have the masking, we have social distancing, we have hand washing, all of these different features. No one is a surefire way to prevent spreading of disease. But when you have enough of these measures all in place, they all help, and they all work slightly differently, and so that all helps drive the process. And so I think that
Definitely.
while masking is one of these layers, even without masking, if enough other layers are present, then you are getting some benefit from all of these other things. And with masking, it makes it so that some of these other things that maybe we can't do, are less important. So
Right.
we know that the school system here in Westborough is crowded. We haven't, built enough schools to have kind of 6-foot distancing with all of our kids. Obviously, I think that would, be a wish list. We'd love to have 6-foot spacing between all our kids. And, I think that the Board of Health has kind of, asked in the past to have kind of creative ways to solve this problem. I think that we've thrown around some ideas, or at least I have, about, ways that you could do this, whether it's, using other buildings or, looking at outdoor space. And, some of these ideas you've, adopted and taken up. Other ones like, having morning and afternoon school session, morning and afternoon session to just spread the kids out to provide more spacing. Things like that, whether, increasing the spacing is one way to solve it. Masking is a different way, and you can do combinations of the two. I don't think that any of those other options, the school board has really done too much of, except for the outdoor space. And I think that the outdoor space in the fall last year and in the spring last year and the fall this year, are major portions of the plan that you guys are going to try to do. And so for that, I am grateful, because I think that does help. The outdoor space is a little bit better for containing the spread of disease, and, helps there. So,
The current guidelines from DESI do not include
No.
spacing.
No.
So there's no spacing recommendations through DESI. I had a question, I'm sorry. Do you have anything
no,
else?
go ahead, jump in.
One thing I didn't see from DESI was if with K through 12 teachers to be masked or not. I'm pretty sure I read that they are not, they're recommending that only unvaccinated teachers
Right.
mask.
Right.
And that was one question I had for you, what your thoughts have been. I know that
yeah.
the teachers' unions just came out within the past maybe 24 hours, arguing for mask mandates, vaccination mandates, which was wonderful. And the other question kind of attached to that is, have they considered any amplification if teachers want to be masked or have to be masked? I know some physicians are doing that, using a portable amplification system, which has helped some people, so.
Yeah, no, those are great questions. Thank you. So just to be clear, I think across all of our schools, we used a range of successful mitigation factors last year. I think we're obviously in a very different place this year because we've made good progress. However, we did a lot of spacing and a lot of alternative space use, not at the high school. We used other spaces as well and spread out. But I do want to be clear that we stripped furniture out of rooms, spaced very appropriately, and were able to achieve that as a very important part of last year's work. This year, we're moving back to more typical classroom frameworks to Dr. Mayer's both question and point, and so that does reduce the spacing. I think the place where that becomes most typically into play tends to be at elementary school, where they will be sitting more closely, but at the same time, they're masked. So the DPH and the DESE guidelines target is all unvaccinated students and adults must be masked at all times, and unvaccinated individuals, both faculty and students that are vaccinated, have the choice to mask. So, again, the whole thing centers on that targeted discussion point. I think if you look at our recommendation, when we met last night at the safety committee, we talked about the way we had used a stage entrance last year, and we had phased to give ourselves time for people to get their practice and to see where we are with implementation. So their preference was that we started with a similar staged planning model from last year, where we opened school with all pre-K to 12 faculty and staff masked through the 17th, which would put us, as we did last year in that discussion, although you had a split vote on that. One case you said it was helpful, and then later said it wasn't particularly beneficial. I would like guidance on where you are in that now. Again, it packages with what you recommend overall, but the preference would be that we mask everyone through the 17th and give ourselves those 10 days past Labor Day and the first 3 weeks of school to look at implementation, to have a chance to have our SNAP data come in on vaccination. That's the nursing data that gives us the updated vaccination rates. Certainly, I think they'll probably be higher than where they were before. And an opportunity to bring everybody back and build routines. So that follows the structure we had utilized last year, kind of takes the pressure off this, pace of immediacy that people are feeling around masking, and gives us a chance to bring everyone back with kind of an equitable, easy flow, focusing on teaching and learning and routines, let you track data with us, with Ray, and give us an opportunity to see the trajectory of how our opening goes. From there, we would then seek your recommendation prior to the end of that time to either move to DPH's guidelines and then let vaccinated individuals begin to selectively choose to mask or not. And that would be based on most current numbers. You've certainly seen a slight climb since the last numbers Ray gave us, between 7 now to 14, so it certainly behooves us within that framework to build a window of opportunity. Certainly our teachers have asked about faculty and people that are traveling for Labor Day and through the end of the summer. And so their recommendation was that they felt that implementation created the buffer that we had utilized before. And so that's currently in the guidelines. From there, we would then seek your guidance prior to the start of September 20th to move to DPH's guidelines. So that's basically the recommendation for masking at the moment. It builds us as a partnership. As I said, this is a partnership, a window of opportunity to continue to look at that data and to see where we are. You then have, the opportunity to say and guide the decisions that then, school committee works with me to implement, whether or not we remain masked or not.
Yeah, so to take the low-hanging fruit first, with
Sure.
the K through 6, obviously the DESE is recommending that they wear masks. It sounds like you guys are on board with them wearing masks. I think that DESE is a recommendation. I think it's a good recommendation.
Well, it's Department of Public Health's recommendation. I
Okay.
think that's important.
Yep.
That's an important nuance to me,
Oh,
because one's a
absolutely.
medical
Okay.
organization and one isn't. DESE is an educational institution. Department of Public Health's guidelines indicate that that's the one I feel that we've selected based upon their medical guidance. And so, not to interrupt you, Dr. Walsh, I just think it's important that people not, you know how people get confused.
Yep.
So as we come into the school year, I think clarity is always very helpful
Yes.
to us.
Yeah, I read it as a joint
yeah.
recommendation.
Yes,
and
yes,
so
a
that's
joint
why I attributed it to
recommendation
DESE, 'cause that's
is
where I read it
similarly,
from.
yes, thank
Yeah.
you. So back to you, yes, they recommend pre-K to 6 remain
Yep.
masked.
And so I think at this point, if we wanted to make a decision about K through 6, we could certainly, talk about that if there's any more discussion we need to do about students K through 6.
I just have one comment. I know you, I think in your guidance, and I have to open it up again, you talked about pre-K, and I know the guidance is for all ages 2 and up to wear masks. I do have some concerns about particularly the pre-K students with language development and emotional development and how masks interfere with that. And I don't know if that's something that's come up in any of the educational discussions, and if you had any comments about that, I'd like to hear that.
I mean, it certainly harkens back to the comments I just made, that the mask wearing is an inhibitor around speech and language interactions, certainly when we're providing service delivery, and around direct instruction, where students are looking at the formulation of words and also socially interacting at a very close level. It is very hard, to get that social engagement from this range when you're little. And I
Yep.
think it's a piece we have to deal with, and the preschool has managed it. But yes, certainly they're within the guidelines from DPH that they should be masked, so I would defer to you.
Yeah, I'm not recommending we go against that, but I did want to hear if there's ongoing dialogue that you're hearing about, at the state level of concerns along those lines.
I mean, I think it covers scope for early childhood, inclusive of kindergarten and first grade, where you're doing all of that developmental phonological awareness. I mean, everybody's been tracking what's been going on with dyslexia and all the early window where the phonological and sound symbol work and formulation of sound is all developed very much in that tight window from pre-K to the end of first grade. So those kids are now coming into 2 years of inhibited learning with this, trying to figure out how to learn to read. So it is a true issue of concern educationally, but again, as you also said insightfully, it has to be weighed against the risk of health.
Yeah, I
And
mean,
that's the burden you bear that brings us to your table.
Yeah, so there are options that are intermediate between the two. Certainly, there could be times and places when removing the mask is appropriate, maybe to make some sort of demonstration or to, correct somebody's speech, briefly, with still the majority of the day being masked. So there are intermediate grounds that could be taken to address some of those concerns if we thought they were sufficiently high to warrant the risk and safety. And I would say that right now, Westborough is doing well, but I feel like sometimes based on the communities around us that, it could dive quickly in the other direction. I know that summers tend to be the best time in terms of least number of cases for respiratory illnesses, and COVID has kind of borne that out over the past, year and a half, 2 years, where we've seen dips over the summer and have it go up in the fall. And so I'm a little nervous about trying to predict what's going to happen in November by looking at August data, just because we do expect increases in the community to happen over that same time frame.
Right.
So I think at this time, though, I'm probably still in favor of, pushing forward with a mask requirement at the K through 6. And I don't know if you want to do something special for pre-K, if you want to introduce some language.
Can I just
either of
ask,
you? Sure.
I have not heard of data, not that, again, we're lacking data, but I have not heard of data that there are, that we've seen a negative result as a result of masking little ones. Am I?
I mean, again, I think we're talking about, cumulative impact. So again, I think, we'll see how their fall assessments look. I mean, to be honest, you're talking about 3 to 5-year-olds who are in emergent learning, and the data is raw data until you are actually instructing them. I mean, our closing benchmark reading numbers on kindergartners were very good, and our teachers are pretty amazing. And despite the circumstances of where we were instructionally, our students made really good progress and gains. So we're going to function highly within whatever structure we have to put in place. We're talking about, slices of choices that are hard to make and require this kind of complexity of discussion. I mean, currently now, the DPH guideline, and again, I don't know, can you do something more lenient than DPH? Like, there is a hierarchy. DPH is recommending that pre-K to 6
Yeah.
are masked.
I think it's a recommendation.
The only,
though, I believe.
So,
yeah.
just to be clear, I'm not suggesting we do something different than the masking for that age group, but I guess what I would like is some ongoing monitoring that you as the school committee and superintendent do of students in those programs to assess if there are problems that need to be looked at or
Sure.
not in that regard.
No, I appreciate that. It
And
certainly would
they will be unmasked outside.
be. Yeah.
And can we certainly encourage any learning to be outside in those groups of kids?
Yeah, it's certainly easier to do, again, you're talking about short term, and all those complexities. But yes, I think our staff make good moment-to-moment instructional decisions. I think it remains more relevantly important if you mandate faculty being masked because they're the ones providing the instruction. So I think it's a piece of the conversation, which is, again, like the recommendations right now that I think I'm anticipating putting in front of school committee would be, and then your feedback would be the pieces that they all put together, would be that vaccinated staff have the opportunity to unmask or flexibly mask based upon vaccination rate as of September 20th, if our numbers are good and our trajectory and work makes sense, because it provides an opportunity for them to do their best instruction.
Let's just finish the students first, and then we can tackle the
Yeah,
faculty
so
right afterwards. Yeah.
the students right now are pre-K to 6. The guideline that I will put in front of them is following DPH guideline, which seems to be the medical guidance from that group. And it would be that they would be wearing masks indoors. And then vaccinated individuals, you do have a few 6th graders that would be vaccinated, but a very small number down at Mill Pond. So we keep pre-K to 6 for the clean methodology, all masked, and 7 to 12 students vaccinated and faculty vaccinated could use selective choice if our benchmark numbers remain where they are. So that's the
Maybe
current
we can-
recommendation.
If we can have a motion then, at least for the K through 12, or sorry,
K through 6.
pre-K through
Yep.
6, and indoors to have them masked. Do you have a motion on
Sure.
that?
I'll move that the Board of Health recommend
You don't want it as a mandate.
So I feel like I like to recommend things to the school committee and let the school committee, have their purview, but if you feel differently, then let someone else make it a mandate.
Do we have a second on that, or?
I second it.
Okay, all in favor? Aye, good. So now let's talk about the staff and the faculty at the pre-K through 6 as our second step. And with this, we've got not only masking, but also vaccination that comes into play because they could be eligible for vaccination, and I think we've got very high vaccination rates, although I'm not sure it's 100%, and so if it's not 100%, I guess one of the questions we want to think about, in addition to whether we want them masked or not, or optionally masked, is whether we want them optionally vaccinated, as opposed to requiring a
Mhm.
vaccination. So I don't know if you guys on the board have any thoughts on this, or whether we want to get thoughts from the schools themselves.
Yeah, I'd like to hear your thoughts.
So, I mean,
Do we know the exact numbers of vaccinated staff?
well, so we'll put out a fresh survey at the close of the year. We were similarly to the students around 95%. So, we'll do we also are doing a lot of hiring. So we'll always do a current draft update. HR just started pulling together the survey data that will go out and ask them to fill in their current vaccination information. So, I think, again, then HR shepherds that through, and optional masking for vaccinated individuals would become available, and unvaccinated individuals would remain masked. That's an enforcement that we own, that's implementation, and that's something we're good at. So, I mean, there is a certain trust factor here that as a superintendent of schools, you think I have the skill to implement your recommendation. So, I think that the requirement is upon me, working with leadership as directed by school committee and you, to implement it with fidelity. And I don't think that you would find Westborough faculty or people that wouldn't. This is a highly professionalized staff who would do, nobody that's unvaccinated is gonna, walk around unmasked.
Do you have any sense as to why certain teachers would choose not to get vaccinated? Especially at the K through 6 age
Yeah, I
group?
mean, I can't even begin to entertain that as a discussion at an open meeting
Yeah.
like this. This is, that's
Okay.
all,
For-
you're a
Well-
medical professional, it's
No.
all private HR discussions. Like, if somebody isn't vaccinated, that's, again, an individual human resources, private conversation.
It doesn't matter if they're a
HIPAA
teacher or
protected,
not.
so, I mean, we know that.
But
as
we're about to have a
physicians, yeah.
discussion later on with the select board about staff in town as well, and so.
Yeah, no, we're in a very good place, and we through HR have the capacity to ask for clarification of vaccination, and if not, then those individuals need to mask within that protocol. We have a good number of vaccinated staff who will probably still select to mask. I held a leadership meeting all day, and we were split like this, like personal choice to sense of that direction, and everybody in that group is vaccinated. So, again, I think you'll see the same type of selected professional and appropriate personal choice between individuals, some who are vaccinated who will selectively be masking throughout the day based upon the task that's in front of them, and unvaccinated individuals who will mask all day. I certainly am very comfortable reporting that number to you, as a total once we have it, and we'll conduct that between now and the start of the school year. So that's a kind of a warm-up piece of HR data that has to come in.
Well, I completely hear you and respect the concern of, vaccinated teachers maybe wanting to not wear a mask and having better ability, to teach their class, to amplify. I am concerned, especially if we see the numbers continue to uptick, that these vaccinated, it's being shown, vaccinated people can carry the virus, can transmit the virus asymptomatically, mild symptoms. So that's my concern. You have a whole room full of unvaccinated children. And
But aren't the unvaccinated children wearing masks the whole time?
they are.
So,
They are, yes.
to that point, again, the single biggest benefit of masks is preventing an infected person from spreading to others. The protection offered to the individual is less. It's not, it's some,
Yeah.
Yep.
but it's less. Nonetheless, when you talk about spreading asymptomatically or very mildly, this gets at the question of, what are we trying to prevent? And are we trying to prevent mild illness? Are we trying to prevent hospitalizations? What is that threshold? And it's not clear at the moment because we don't know what are the long-term effects of even a mild illness. And some mild illnesses last a long time. There's a lot of unknowns.
Right.
I personally don't have a problem with the vaccinated teachers being unmasked because I think that the risk, especially in our community, is relatively low, and we will follow the data, closely. But I do have one group that I would strongly urge to, I don't want to say mandate a vaccine, and that is the teachers who are teaching pre-K through, say, grade 1, where we think that there is an educational benefit to being unmasked, if not all the time, at many, significant portions of the time, and there's often very close work in direct, close physical proximity to the children. So I don't know if you can ensure that population is vaccinated because there is an educational need that isn't necessarily present in 5th or 6th grade class.
Yeah, I think it's, I think what makes sense, and I appreciate the logic of the discussion. I think the same, it strands across a range of types of conversation. Then you have people that are doing special education service delivery up
Sure.
close with complex learners. And so, again, I can't singularly stratify it to K and 1 in terms of like the benefit or not versus, a speech and language pathologist working with a 6th grader with auditory learning issues. So for me, it's, it's got a little bit more depth of complexity to it. I certainly, if we follow the track of the conversation, however, the discussion point is, the percentage of Westborough faculty that are vaccinated, and it is exceptionally high. And I'm very happy to make sure that we come back with clear, clean data on that percentage for you and a reassurance if you want to wait for that data between now. Again, I built a window for us to have a little bit of time to get everybody in, get all our HR data updated, and across that first week, make sure we complete that update, provide it for you, and you can vote then. Because faculty are masked until the 17th anyway, if you accept that. I have the right to initiate that anyway, and if they voted, I'll do that. If you came out like flexible that DPH guidelines were fine, regardless, it makes better sense that those first 3 weeks, we build a window. That's what the safety committee wanted. Part of this is relationship with them as well, and so I see that as a guideline that I would be putting forward to school committee. And from there, we have a window of opportunity to get clean data, and you can decide how you feel. Not to kick the can down the road, but if we're using it for data, let me bring you the data, and then you can make a motion that you feels, grounded in that update.
So obviously the risk in waiting is that if we wanted to have all of the faculty that are in a particular group or, range of teaching students that to be vaccinated before school starts, waiting to collect the data to figure out there are, 4 teachers or however many teachers that aren't vaccinated. Obviously, that's then starting school with them not vaccinated. So in order to give them time to get vaccinated, if that was something that the board felt strongly about, we'd probably want to do that before you had time to collect all that data and get back to us, the day that school is starting. It's just, I'm not sure that we'd have enough time to turn around a way to get them vaccinated.
Yeah, no, I hear you. I would say that I'm surprised by the turn of this conversation 2.5 weeks before I'm opening school, and I feel protective of the process with our faculty that I feel like they would deserve a longer window on that. So again, I feel like I need to be able to step back and think about that process-wise and have the right conversation with the right range of people. I feel confident that our staff is so well covered vaccination-wide that I don't believe that it's a gigantic issue, but the devil's in the detail. And so do I want to open school with a most treasured first grade teacher on the sideline because for the larger good, you're going to then ask her to be vaccinated when she could be in a mask? I don't know. I have amazing teachers who are cancer patients who are choosing to come back and teach, might not be able to vaccinate, but they're going to work because they value their job and they're great. So again, these cases are very individual. So, for me, it's the differential of if that person can't vaccinate, but they can teach at a high level, they're going to have to wear a mask and they're going to do their job. And many of them double mask. And if I have a teacher who is vaccinated, the implementation of flexibility to mask or not mask is the request, and I'll let you take your vote on that. So again, I think I can't speak to, again, the HIPAA perspective of case by case, and so I would want to look at that with more data.
I certainly don't want a particular case discussed at an open meeting. If you're aware of some kind of general issues, if in general cancer patients can't get vaccinated, that would be a kind of interest.
It's very individual. I have
No,
cancer
and
patients who are vaccinated and those that aren't. So
Okay.
from the perspective of this, and again, I don't want to go down the rabbit hole on this, I wouldn't break apart separation of my faculty at this point. So my instinctual feeling is, while well-intentioned, it's a fragmented approach that we're discussing right now, and I'm not comfortable with it. I don't think it meets the value of the way that we would want to engage in this conversation, because I think we would be randomly making a decision here.
Well,
and I'm not
splitting
comfortable with
pre-K to
that.
1 may be
Well,
too fine a distinction, but
Sure.
pre-K through 6th grade, where you have students, a whole room of kids that are unvaccinated, I do believe we do want to look at separately from those that are 7 through 12, for instance. And we may end up coming to the same conclusion for each of these groups, but I think looking at them separately is important because there are very big differences in the one of the layers of protection, which is the vaccination.
Can we even mandate vaccination?
I'm not sure,
to
that-
teachers?
I'm not sure you can, so
Sure we can.
I think, I mean,
So
not to
some
tell
other
you what to do
towns
for your
have
board,
actually already
but,
taken
yeah.
this step.
Really?
Yeah.
Good.
Some school systems have, but I'm not willing to risk losing our teachers over this. We're talking about a small, very small number of teachers. You put down a mandate, and we don't have the staff we need to open the building because we're hiring 1 week before school starts.
well, I think to the discussion point, some districts have it as a part of a settled contractual agreement. That's not a piece of the work we did. Like, there's layers of complexity to that I'm thinking, if we go back to this discussion, if you back all the way up to the original, like, every mitigation factor has pros and cons value, and you have to weigh out the measure of that. So we've taught successfully with the structure we've had where teachers were masked, vaccinated or unvaccinated last year, and, you know, did not have transmission and issues with our instruction or illness. So, you know, for me, I don't feel like, while I hear there's a risk that if you have an unvaccinated teacher who's in a mask teaching, I would say the data of last year's implementation is indicative of the fact that their masking and their work was protective. So, you know, getting into this 2 weeks before school opens now seems like we would have had that discussion last year. It's the same teachers in the same group, and there was much more
A lot of-
illness, so,
go
yeah.
ahead.
There is a difference, which is,
The Delta.
you know, last year was primarily hybrid, and there's greater physical social distancing that was implemented. And so, again, I don't think we should be belaboring this, because I don't think
Yeah.
anyone on the board is, at this point in the conversation, going to recommend something, you know, going against what you're saying in terms of starting this school district with everybody masked for a couple of weeks and figuring out what exactly is the vaccination status of both students and teachers,
Right.
and coming back when we have more data to reassess. I mean, are you both in agreement with that?
I am, and one thing we certainly could mandate is that unvaccinated teachers mask. I mean, because as you were saying, you can have guidelines, but if it's also coming down from us as a mandate, I think that makes a statement as well.
Yeah. I think that for the K through 12, in light of the fact that we don't have any sort of requirement for the teachers to be vaccinated, I actually would be in favor of a motion that requires them to wear masks at that K through 6 level while they're teaching the unvaccinated kids.
You're saying
So-
all teachers, vaccinated or not, should wear masks
At the K
At
through
the-
6.
for the entire year, or you're saying just for
Well-
the first couple of weeks, or what are we talking about?
Certainly to start out, I think that
Okay.
while we don't have any requirement for them to be vaccinated, that is a concern.
So we're talking about vaccinated, I thought you said unvaccinated, not
So
vaccinated.
if we don't have a requirement for vaccination,
Yes,
that means there are some teachers that could choose to be unvaccinated,
yep,
and then I would prefer that then we have a requirement that the teachers at that age group are wearing masks. Now, that's, I think, a little more extreme than either of my
It is,
colleagues.
because if Amber's telling us that 95% of the teachers are vaccinated, then we're making a rule that mandates everybody wear masks because a small number aren't. And I honestly believe that there will be teachers who are vaccinated who wish to wear masks, and there's no
Right.
problem with that. And I don't think it's going to stigmatize people who are, you know, who are wearing masks versus not wearing masks. I think there's going to be a lot of that throughout society, whether you go to the grocery store, you're in a meeting like this, or in any employment situation. But I just, if we, one of the arguments across the country is that what's the benefit of getting vaccinated? And one of the benefits of getting vaccinated is that you're able to lead a somewhat more normal life. There are more things that you're able to do. And so to say to a large group of vaccinated people, because there are a couple within your midst who are unvaccinated, we're going to impose this mandate on you, I think, to me, it sends the wrong message.
Well, that's not the only reason. I mean, to me, the main reason is they're teaching unvaccinated children. Yes, they're masked. I would make a motion, or I would recommend that we reassess this at that end of September and look at the metrics, look at the numbers before we say that vaccinated teachers K through 6 have the choice. Since you're already planning on having all teachers masked through, September.
17th.
Thank you.
I mean, I think that, again, I think that's if I hear your motion or your recommendation would be that we implement with the 3-week window as staged, that gives us an opportunity to get updated numbers, to look at the start of the school year, to bring back people with confidence as opposed to anxieties or anger or frustration or all the other things that impede everyone's capacity to do a good job and to welcome back the school year. That both parents, faculty, and students, because you're talking about a whole bunch. We haven't even talked about 7 to 12 students, who have a range of opinions about it as well and thoughts. So yes, I believe that waiting until we can return, we'll look at updated data on vaccination rates for students and faculty and be able to have a very concrete discussion with clean motions. I'll have a chance to let the discussion that you've had here, let feedback filter back to me from all the various groups that will have opinions about the discussion, and it will give us a sense of where we are. And so I think that feels logical to me.
Yeah, well, with such a diverse set of opinions shared by this board, I think the safest approach forward is a motion to have a 3-week window where the teachers are masked, and that we plan on reassessing, and it could go either way at that point as to what our recommendation is next. And so I think that you've heard some of the comments that have been presented here, and so to bring those back to your groups and let them know kind of where different members of the board stand so that you can get appropriate feedback and comments. And, I think that that's probably a very safe move for us. So
Sure.
Let's have that motion. I'll make that motion if you want.
I second it.
Okay, all in favor?
Aye.
Aye. And then I think that the other thing that you had mentioned was activities at school, and to get some guidance from us on to, what that back to normal reopening looks like for different activities. We have kind of sports, band, chorus, all of those sorts of things, plus all of the meetings and events and things like that the school does.
Yeah, so typically, the implementation of the start of the school year is delineated for sports and for fine arts and music. The music notations are in here as current to the accepted practice. And sports, MIAA has been very, very clear, and our implementation was clean last year, and we'll follow those guidelines. And typically, we would call and have, if there's any question around an event, run it by Ray. He speaks to you. We either have a consult via phone or we bring it back to the board. Events such as the early calendar list of events for open houses, back to school nights, we'll start drawing up a set of calendar dates and look at the recommendations that make sense building by building, check them against protocols with Ray or our new director. And then if there's a question that it falls outside of current protocol, we would seek consult.
So there were a number of things last year with sports and things like that, where some sports were moved to kind of the middle of the year and
Right.
schedules were all changed. Is the plan this year that MIA across all the schools is back to normal, or are there still
They're
changes? or
certainly
how-
looking to do that. I mean, for example, I got the question today because if you look at the 3-week window for everyone masked pre-K to 12, it means that all indoor sports, so the indoor volleyball teams will be playing in masks. Now, MIAA might not require that currently, that vaccinated individuals can be without masks, but we'll follow the guideline of having them mask. So we'll overreach on certain guidelines because we're going to be consistent. But yeah, all of those indoor activities will set those parameters within our own guidelines or within MIAA. So we'll always be over, we won't be under.
Do you guys have any comments on it? Ray?
Excuse me, Nathan.
Yeah.
Just so you know, part of the meeting with the select board tonight is talking about public meeting and events and on town property and everything. So we want to make sure the guidelines for schools and town are together. So I think that was something we were going to talk about together.
Okay.
I think today we were talking about in-school class masking. I know you wanted to talk about other programs, but I think that's going to fall under what you're going to discuss with the select
No, I
board
think
tonight.
that's good. If, maybe we can then finish up with kind of the 7 through 12, and then maybe do a joint meeting with the select board to get their opinion on some of these,
Yeah.
public sort of events that might be accessible by the whole town in terms
Yeah,
of visitors
no,
and
that's
stuff like
fine.
that.
I mean, I think currently, based upon your motion that you just made to implement the 3 weeks with everyone masks carries pre-K to 12 for all students and pre-K to 12 for all staff. So I don't know that there's much of a discussion until we come back and you look at your data. I mean, you know, given where you are time-wise, it might be better to do those both together again. So I'll bring you back current vaccination rates on 7 to 12, and you can consider to track the numbers about where we are with illness in the community, and we'll come back to you with that data for you to use your medical guidance.
I guess my question is, and what you had, what you have written up here is that window of time, it mentioned that you wanted to collect vaccination data on all the students, and then, so that you know who should be masked and who can be unmasked as of September 20th.
Right.
So my question to that, and as has come down from other organizations, is do we really want to, who's enforcing that?
Sure.
Is that gonna?
Yeah. I mean, obviously, anything that happens inside the doors of the school is enforced by us and by the protocols and guidelines of the leadership team working with their faculty. I think, one, we have fabulous kids in Westborough. Let's just start by saying that. They are amazingly polite, kind, compliant, and they're wonderful to work with. So it's not like I'm in a community where enforcing that's much of a difficulty. That doesn't mean that we won't have to make sure that we have, some protocols around vigilance, and the nurses will have questions about that. I might have a different feeling about that if my number comes back differently, but when you're looking at 95% vaccination rate, and it's probably higher now when we get fresh data out of SNAP, it's not too complex. So we enforce much more complex things. I have a lot of confidence in our staff.
So before we leave this issue, there was one thing that was brought up to me, and that was that in the past, I think that when students needed to take like a drink of water, a lot of them had to leave the classroom in order to take a drink of water. In a room where we have the students, especially at the 7 through 12, that are mostly vaccinated, the teachers are mostly vaccinated. Is there something we can do where people can pull down their mask, take a sip of water, and pull up their masks, and allow something along those lines, or does that make it too much of a slippery slope where then, people are just, well, I've got my coffee cup on the table, so I don't need a mask?
So I think there's a range, again, that's building-based implementation against your mask guidelines, and I think I have confidence that there'll be variability. Some teachers required students to step into the hall, others were comfortable if they stepped to an area in the back of the room, so I consider that professional faculty's implementation of the guidelines. And so, I don't know that we need to bring it to that level of refinement here. If you're at a place where, if your guidance to me at the end of looking at the data is that you want all students and teachers masked all year, then yes, we're going to have a range of discussion around how much flexibility can be built into that, because it's a long year and they spend a lot of time together, 6 hours a day, and the complexities of building in mask breaks and all of that. So dependent upon your action, it has a lot of implications for our year, and it has a lot of implications for whether or not I have to go back and then build up a different protocol for mask breaks. Can they take place in the room when you have vaccinated kids? And that will feel illogical. And so there's lots of cascading implementation that is our job based upon your guidance. So we will certainly move forward to get you data. You have my recommendation based upon illness rates and vaccination in the community. And I'll come back to you and we'll look at vaccination rates and illness in the community and you can use your medical judgment to make a decision.
So do we want the same motion then that we had for the pre-K through 6 for the 7 through 12? Or do we want anything?
I don't think
Change
we
from that.
specified whether it was K through 6, so,
Okay,
right?
good.
Whoever's
Paul is the
taking
arbiter
minutes.
of what we specified.
I think it was just,
For the whole schools.
Yeah, you did.
Okay. Well, then I think that very clearly sums up that portion. So thank you, Amber and
Yeah.
Kristen.
Thank
Appreciate
you,
you guys
guys.
coming in.
Appreciate
If
it.
you want to stay for the
No, I
meeting.
want to go
Okay,
home,
that's fine too.
but I appreciate the offer.
So I want to thank the,
selectmen are very comfortable when I leave, so.
I want to thank the select board for being so patient as we work through this. You guys feel free to come up and grab a chair up here. I think there are some people that have tried to connect remotely. Do we need to shift at all, or?
There's 4 spots over there and 1 over here. Unless you want to swing down, it's up to you. I think they can just grab seats. I think they'll be fine. I don't think they'll mind being separated by a few.
Okay. So I don't know if you have to call your meeting into order and,
That's his job.
okay,
I'm just the lowly vice chair.
we'll let you guys get settled.
Okay. So it being a few minutes after 7 p.m. on Tuesday, August 10th, 2021, I hereby call the Select Board to order as part of a joint meeting of the Select Board and Board of Health, the agenda having been properly posted by the town clerk. We have one item on the agenda this evening, which is a discussion, town operations and large gatherings pertaining to COVID-19. I probably have to read this again. Pursuant to Chapter 20 of the Acts of 2021, this meeting will be conducted in person and via remote means in accordance with applicable law. This means that members of the public body, as well as members of the public, may access this meeting in person or via virtual means. In-person attendance will be at the meeting location here at Memorial Hall at Town Hall, and it is possible that any or all members of the public body may attend remotely with in-person attendance consisting of members of the public. This meeting may also be accessed remotely via https://meet.google.com/DTOYDIIBPI or by phone at 1-563-316-2564, PIN number 580469930 hashtag. When required by law or allowed by the chair, persons wishing to provide public comment or otherwise participate in the meeting may do so by in-person attendance or by accessing the meeting remotely, as noted above. Additionally, the meeting will be broadcast live in real time via Westborough TV on local cable, Verizon Channel 28 and Charter 192, and their online platforms, westboroughTV.org and youtube.com/WestboroughTV.
Great, so I think that some of you had caught some of the comments that we've had earlier with the school department, so I don't think we have to re-go through all of the numbers and facts around where the town is unless somebody wants us to go over that. And so I think that right now we're going to start the discussion about, what we can do in town and what we think is safe and, how we want to handle these. We may have to find a way to mute some of the people that are on. I think, Christy, you're online there?
Yep. Can you hear me?
Yes, we can.
Yes.
Okay.
You were raising
Do you
your
mind
hand.
if I start?
I don't mind if you start. You were raising your
ahead.
hand. I thought you wanted to go ahead.
Oh, yes, I did, thank you. So we had asked to be on this agenda, just sort of given everything that we're all seeing in the news related to the Delta variant. I think it worked out really well that the schools went first, because I think that, we certainly want to be consistent across the town and schools in terms of how we're dealing with this with our employees and also with gatherings. And so, at our last meeting, joint meeting of the Board of Health and the Select Board, we had, or you all had voted or had decided to move forward with any CDC and Department of Public Health guidance. And so that's what we've been doing. where we're recommending masking for unvaccinated folks, but we are not requiring it. Similar to the schools, we're not mandating vaccination. We're not requiring proof of vaccination. We've received a lot of questions in the last week, specifically to upcoming meetings or events and whether or not those can move forward. Again, looking at the guidance from the CDC and DPH, our understanding is that those types of events can move forward where they're outdoors, masking is not required, where they're indoors, masking is recommended. But we just wanted, I think, a touch base with all of you. We also, have you on our agenda for August 24th. So similar to the schools, there's definitely opportunity for follow-up following this meeting.
Thank you. So, Ellen, I don't know if you want to jump in here or if you want me to lead this discussion.
Go ahead, you start.
Okay. So I guess there's a couple of different parts to that. Let's try to split it out a little bit. And so we've got things that are happening that are indoors. We have things that are happening that are outdoors. And if we start with the indoor activities that might be going on, there are some activities where there are reasonable spacing between people. And then there are certain indoor activities where we might not be able to maintain spacing between groups. So I think each of those represents slightly different divisions that probably should be handled separately. And so I first think that we should tackle those areas that are probably the most difficult, the indoor, where you can't maintain adequate distance between people. And if it's open to the public, you don't know their vaccination status, although I think that here in Westborough, the chances are that the person next to you is vaccinated. There is still a pretty good chance that, if it's open to the public, that someone might not be. So I guess my feeling on that is that, in those cases where it's really tightly packed, I certainly would think that we'd want to recommend masking, but I don't know if there's anyone else that wants to go further than that.
So what type of events are we describing here, just so I can have a sort of concrete image?
Sure. So one specifically that's coming up on August 24th is the annual fire department picnic at the senior center. So they do cook outside, but they eat indoors. So that's one of the events. And then the other one that I've been specifically asked about is public meetings. So a public meeting similar to the one that you're having this evening, whether or not those should move virtual, whether or not people should be masked. At this point, we've still offered people the same flexibility that you have tonight for your meeting.
And one other example, I think earlier they were talking about volleyball games and that sort of thing. And so if there were visitors allowed at an indoor volleyball game, would
basketball game
or a
going
basketball game. Yep, actually, any of those where you might be sitting in the seating and be, spaced closely together. Do you think it rises to the level of a mandate where we want to require people to wear masks at those events where they can't maintain 6 feet of distance? Or do you think that we should keep
I guess I would ask the question, why would we treat these events different than, let's say, restaurants in town, where you may have, we now let people sit at bars where you're one person right next to another, and people make free choices to their level of risk tolerance.
So the fundamental difference, to just kind of answer the rhetorical question, I think, is that this is town-owned property that we're talking about. These are town events, and so the town is then therefore responsible for what happens at our events. And so just like a business could decide whether they want to require masking or not, what we're asking ourselves is whether the town wants to require masking at our events. I think that we are leaders to the business community in some ways. They're going to look at us and decide what we do at our meetings. They might look and reflect on when they are having a meeting within their company.
Yep.
And
so the response about we're just another business in town like any other is that if we felt the risk was significant enough, we can mandate all businesses in town have people in their, let's say all restaurants, everybody has to be masked. That's exactly the situation in Provincetown right now because they have high risk. Okay, our risk here is low, but if we're going to do that for town events, I would want to know if you think we ought to be doing it for all events. And if not, to me, I think the very high vaccination rates, I've used the term in conversation with people of herd immunity. herd immunity doesn't mean no one gets a COVID infection. What it means is that when someone gets infected, the likelihood of them transmitting it to others and having a cascading effect is very small. And I believe that that is the status, not just in Westborough, but in the enclave. If you look around the neighboring towns, also with very high vaccination rates, really the ones, if you want to see who's got very high vaccination rates, you look at who participated in that vaccination clinic with us.
So I think we've got a comment from the select board.
Yes. Go
Several,
ahead, and then
actually.
I have a comment.
Yeah, so I think we need to be very careful with stating that the risks are very low. The CDC has come out very clearly recently and stated that Worcester County is actually at a significant risk. Not only that, 9 out of the 10 bordering counties to Worcester County are all also considered substantial risk. Worcester County only has a 52% vaccination rate. We are a very central avenue in and out of this county from Middlesex County with Route 9, 495. All of our businesses deal with many, many people inside and outside of this community. So I think we need to be very careful with saying that it's a low transmission rate. Delta variant and now Lambda variant are both being shown to be very highly transmissive, according to all the CDC and Department of Public Health data that I've seen from Massachusetts. So I agree. There's certainly a sensitivity that we need to show to, our public spaces and certainly to our businesses. But I think at the same time, we as multiple boards need to take on the responsibility to say what is best for our community to make sure we protect our citizens, and not only our citizens, but those people that come in and out of our community on a regular basis.
Thank you.
And so when we look at indoor activities, there's two kinds. There's operation of town as government, and then there are events. And knowing, and here's where we are somewhat different from the school system. Most of our town offices, not all, but most have adequate spacing between employees, 3 feet or more. We have, there's still public-facing offices in town that have plexiglass up to provide a measure of protection. There are those that don't currently, but could easily put theirs back up. Recognizing that the vaccination rate in Westborough is really high, there are town departments that do regularly deal with people who come into the buildings who aren't necessarily from Westborough, contractors coming in about building permits or to meet with the building department, not to make a case out of it, but is one example of that. And so taking that with the guidance, I'm feeling comfortable that, currently right now, we're not, people who are vaccinated, we're not requiring them to wear masks. People who aren't, we're recommending. It's nothing, I see no qualms saying, having signs on the door saying, if you haven't been vaccinated, please wear a mask.
Sure.
And making that request and sort of setting that expectation for courtesy as far as operations go. When I look at indoor events and public meetings, again, there I'm falling at that level as well. That we should be asking people who aren't vaccinated to mask for their protection and the protection of others. People who are vaccinated should mask or not mask based on their comfort, and we'll have a hybrid environment, and not. I don't think there's enough data or there's enough risk at this point to start mandating masks. I think the way we're operating currently is sufficient for now. We have an opportunity on the 24th as a select board to review as data is more clear. We're then back to twice-a-month meetings where we can adjust as needed based on data and trend. I also think it's important to note, and I know this has been talked about, that the goal of the protocols isn't to 100% stop the spread of COVID-19. That's not, no matter what we do, that's not going to happen, right? It's to prevent hospitalizations, it's to prevent death, it's to prevent uncontrolled spread.
Well, it depends on who you talk to.
Well, I mean, I guess, and so this is my opinion. We're not going to completely stop the spread, right?
Well,
And
some people believe that it's our duty, even though we have a high vaccinated town, you know, we are surrounded by other towns that aren't nearly as high, and it's our duty to, you know, and we have people obviously in our town from other towns all the time. It's a totally, that's, we're
Right.
talking private businesses versus town, you know. Well, if we get back to the town, I do think they're separate conversations. But,
Oh,
anyway, but, you know, to
No, I
talk about,
agree that-
talking about our duty to stop the spread, you know, a lot of people believe that it is not just about hospitalizations and death, and I'm certainly one of them.
okay.
Yeah, so I think that to follow up on several of the points that have been made tonight, and that's, when we talk about the spread of the virus, if you imagine that for every person that gets sick, how many new people get sick from that initial case, that's referred to as the R number, and when it's greater than 1, that means that the disease is spreading. When it's less than 1, you start to get to kind of this herd immunity, that whatever your practices you put in place are actually sufficient to actually drop the number of cases over time. And so I think that what we would really love to be is less than 1, obviously,
Agreed.
but you can actually make it a lot less than 1, which actually drives it out quicker. Now, you can also put so much excessive regulations and burden on people that you would drive businesses or people out of town and just make life difficult for the people that live here. And so what we're trying to do is find that right balance for our policies. I think that if we can do the right thing as a town, that kind of gives an example for how other people, when they look at us, how they might want to conduct their own affairs. And so there are some of us that, you know, I think, you know, are looking at these issues and trying to, you know, I think all of us are looking at these issues, but trying to figure out, you know, what to do. And I think that if we go back to the specific cases, and, you know, if we focus first on those cases where you're indoors and you're crowded and we can tackle that situation first, the other examples might become a little bit simpler. Go ahead.
I'll go back to what you said. I had something else to say, but I'll wait. I'll hold that. I guess the question I have is, I think it's really difficult to mandate something saying, okay, if you can't distance, then we need to make everything masked without someone being there. Like, what is, I mean, 3 feet, 6 feet, are we going to ask who's ever controlling it? So let's think about back to a volleyball game, and it comes in and there's people in the stands and there's seating for 500 and there's 50 people there. We don't know if they're all going to sit together, so do we just mandate they mask, or do we say they can separate? I guess I'm a little confused.
This is the exact question we're trying to answer, right? Is
Yeah,
that
and that's
in these cases, what does the policy?
So I think you do one. I think you got to do one of two things. Personally, it's either you mandate that anything indoors is fully masked because it's going to be really tough to enforce on a case-by-case basis, or we go back to a situation similar to what Select Board Member Edinburgh said, that is kind of the policy we're following, and continue to follow the numbers. That basically is that our request is that unvaccinated people mask at all times, and then those that are vaccinated are optional. They can wear masks or they don't. My concern is getting to a layer, trying to look at each one separately, I think is going to be really difficult, or we need to have every single indoor event come in front of the board or the Board of Health requesting action by
We
those.
certainly don't want the role of.
You could-
individually
I don't think we
looking
do
at every
either.
event. That's not what we would like, no. Did you have?
You
something?
could do it by number. I mean, certainly events like we had in the past, events of certain sizes, you know, run by the town or based on, you know, numbers of people. We certainly could do it that way. You know, one thing about.
Versus capacity of like a
vers-
room or a building. So if a building,
No.
if we have 100 people, but the building can seat 1,000, is that? That's.
I know,
yeah.
I hear you. It definitely gets confusing. One thing with town meetings that,
Christie?
You mean to cut you off, just
No.
drawing attention to Christie.
Yep.
had her hand.
sure, one thing about town meetings that I have thought about is you certainly want to make sure everyone feels comfortable going to a town meeting. And in a room, let's say such as this, let's say this room was filled, you know, I think some people would be uncomfortable coming into a big group like this if it wasn't masked. And you don't want people in a town, you know, not coming to a meeting for that reason, so.
So I think Christy wanted to say something, and then I think we have some other people from the select board that wanted to join in as well.
Yeah, thank you. I just wanted to clarify that, that we don't have control over the schools. So certainly if we were to hold a recreation event or town meeting, you know, we could make decisions about masking for those types of events if they were held in school buildings. But in terms of your discussion related to upcoming, you know, sports that might take place inside, I think that discussion is more appropriate with the school committee or the superintendent.
Thank you.
Thank you.
She did say that something like that might be more appropriate to discuss here at this meeting, and which is why we're discussing it here, because we just talked with Amber, and she basically said that she kind of wanted us to help solve that with the input from the select board, so.
Okay, all right, so I just wanted to just be clear that any recommendation you make related to the school buildings, we wouldn't be able to implement.
Yeah, I guess, Ian, I agree with you in that we need to understand those kind of nuances and how we separate that out. I guess I just want to remind people that, again, the premise by which, you know, decisions were made, I think last year, were around Alpha variant, and now we're in Delta variant, and it is actually contagious to those that are vaccinated. So that is, I think, something that we need to consider. So even if you are vaccinated and you come to a public event, you could be a carrier of this and transport it to others. I agree that there's a fine line that needs to be drawn between, you know, where do we set that boundary? How do we tell people, you know, if an event is X size, or, you know, you have a hall of 550 people show up, did you have to make a mandate that only, you know, the event required masks? I think we need to provide that level of clarity to the community as to what that means. I would go further, even in the public departments. I think we need to decide whether or not mask needs to be worn by the staff versus and or by the public coming into these public spaces, into these buildings. Because Alan, to your point, we have a number of people that are coming in and out of that are outside the community into every single one of the departments, right? So, you know, are we going to require them if we require our employees to wear masks, right? So something I think for further discussion.
Thank you. So I don't want to take up a lot of time, but I want to say that I support the comments made by fellow board members Enberg and Johnson. And while I agree with Mr. Welch's comments, I'm sort of in a place that we follow the CDC recommendations as they are, and we watch it. We did a fantastic, amazing job as a community adapting to last year, adapting to where we needed to be. We've done a great job with vaccinations, and we don't live in a bubble. We all know that. There's a transient population. We swell during the day, not quite to where we were before because of COVID, but certainly those numbers are coming back. But I don't want to simplify this too much because I know it's complicated, but I think that following the guidelines that we've discussed multiple times here this evening, watching the numbers, if we have unique events such as town meeting, and, you know, we want to encourage turnout, and, you know, we can mandate a mask for that event. That's what I heard our town manager say. I think that's what you all said as well. And, you know, we revisit this in August, and we'll probably have to revisit it in September, and you know, it'll start to feel a little bit like Groundhog Day, and hopefully it's a nothing conversation, right? That's what we're all hoping for. But I think that beyond that at this point, I think it's speculation, and I think, Dr. Ehrlich, you made this point earlier when Superintendent Buck was speaking, and that is that, you know, there is, unfortunately, one of the downsides to the vaccination is that people that are vaccinated are getting infected. So that's kind of a deterrent to encouraging others to be vaccinated, but it is what it is, right? So, you know, that's my feeling. I do have a follow-on question for our town manager, and it was asked of the schools to understand kind of what percent, if we know it, what percent of our town employees are currently vaccinated, and if we don't, do we intend to get that those numbers? And if we don't,
I would sort of ask, why not if we're doing that on the school side?
No, we don't have that information. We haven't requested or required that information. We're trying to understand what we can request. So I would say that we're in a similar position as the superintendent stated, where, you know, we can work to get some information for a follow-up meeting. But I think, you know, Alan mentioned this earlier, and something we've talked about a lot internally is that, you know, not saying this is a reason to not get information, but certainly something to keep in mind as we try to be consistent with the schools, but understand some differences, and that's that the town buildings, we are, you know, we are able to distance more. That's more than what you would ask for. So the answer is no, we don't have that information. You know, we can certainly look at that for a follow-on meeting.
Dr. Ehrlich?
Yeah, so I wanted to address the comments about the Delta variant, because this has come up a number of times this evening. And it is true the Delta variant is much more transmissible, more easily transmitted, more easily infectious. But nonetheless, the current vaccinations provide high degrees of protection against the Delta variant, and particularly against the Delta variant causing serious infection. I want to go over what happened in Provincetown, because I think it's interesting from a statistical perspective. So, to understand, for those of you who've never been to Provincetown, it's a very small town at the tip of Cape Cod, very narrow streets, old buildings, and it has a year-round population of approximately 2,500, of whom 97% or more are vaccinated. It's a very popular tourist destination in the summer, and at the start of the 4th of July weekend, there were approximately 10,000 people in the town. They have a lot of day visitors, and over the 4th of July weekend, there were some events happening. The population swelled to between 50 and 60,000 people. The weather was bad, and everybody was indoors. And so you have bars and restaurants that are really packed to capacity, people in there for long periods of time, and it's what I would describe as an ideal situation for transmission of any infectious disease, COVID included. And what happened was they had about 700 or 800 cases. About 3/4 of those were in vaccinated people, but of course the vast majority of people were vaccinated, to the best of our knowledge, and so even your risk was much higher if you were unvaccinated, because the proportion of unvaccinated being smaller. Of those who were infected, I believe the number who required hospitalization was in the single digits. I don't know the exact number off the top of my head. And so the people who were immunized, and some of those who had to be hospitalized were people who were vaccinated. Okay, so vaccination does not prevent you from getting hospitalized, but it's still a very small percentage of all the people who were potentially exposed, a small percentage of all the people who got infected. I did have a friend of mine who was in Provincetown that weekend, got infected, and what he described was he had a fever. If our office had in person, he would have just stayed home for the day and worked from home. And the next day he felt fine. And I think that is typical. Many of the cases were very mild, but it doesn't mean that there are no serious events. And so everyone has to assess their own risk tolerance. What other diseases do you have? Do you have things that put you at greater risk for more serious illness if you get infected? And that's going to vary from person to person. But taking all that into account, when they say Delta virus is much more transmissible amongst the vaccinated population, you're still largely protected from any type of serious illness.
Thank you. So I think that, again, I'd still like to return to the point of, do we want to take some action about, you know, the different types of things that the town does, and in particular, you know, those cases, as Alan described it in Provincetown, if we're having some sort of meeting that is at capacity or nearing capacity, you know, is there a point at which it tips the scales and we decide that this meeting is, or this event is better with masks than without? And certainly I can look up here and see that this room has a rated capacity of 143. If we had 143 people in here, I think we should be wearing masks. And so there is some point though where if there's only 12 of us in here, then, you know, I don't think I'd require everyone to wear masks. So for me, there is some sort of flexibility here where I think that as it does get more crowded, and these events do become situations where you can spread the disease, that mandating the masks makes sense. What that limit is, I haven't quite decided in my head, but that's kind of where I'm leaning.
I guess I want to lean heavily on personal responsibility and past experience here in Westborough. So I envision, and again, I'll use the sporting event, even though that ultimately falls to the jurisdiction of the schools, but Westborough's playing a rival in basketball or volleyball. There's going to be a great turnout. I personally believe that a lot of people are going to show up with masks. So they're going to be like, or they're going to have one. And like, as it gets more crowded, it's going to go on. I was at an event yesterday and it was largely outside. We went inside. A lot of people I didn't know, I put a mask on. And I guess maybe it's my faith in humankind, but in what we've been through in the past year, that combined with the vaccination rate, that I think people will do the right thing. But to Ian's point earlier, it's like, if right now, today, if we start to sort of set those parameters of building capacity and this, that, or anything, I mean, we don't have people necessarily, standing at the door counting how many people are coming in. So I think it's got to be kind of a judgment call. And even to the point of, if we were having a meeting here and all of a sudden we have a packed house, then town staff need to be ready with masks. I mean, I don't know. I mean, maybe you call the audible.
Yeah, well, I mean, I think the
say,
same is
you
true
know
right
what,
now for the
we're
fire
at-
marshal, right?
Right,
And
we're at a
we're
place.
looking at the room capacity and it's 143. And as we approach 143, we're not necessarily there with a
No,
clicker ahead of
right,
time.
right.
But as it gets crowded, we start to realize that it's crowded and that maybe we do have to assess whether we're over
Right,
the
so we gotta have
capacity of
masks
the
on,
room.
right, we have to have masks on hand, because some people will come with them, some people won't, and then, and again, you hope that,
Yeah, I just, my point is that I don't think the logistics are as hard as you're making it out. If it turned out that it was, if you're more than 20 people or more than 20% capacity, that you need to wear masks, that's not too hard to figure out, especially if we're already figuring out what the fire capacity of the room is.
I guess I'm
you know.
saying, I don't think we need to go there with even recommending based on capacity. I think at this point in time, we should leave it to the guidelines that are in place and the numbers that we're experiencing today in town.
So
I mean, I want to get some other opinions too, because I think that
So-
Shelby and I have been talking a lot.
So I would respectfully disagree with Shelby.
It's okay.
And while I definitely would love to believe that citizens and residents will always do the right thing, that is not always the case. And I'll give a really brief example. I'm aware of an issue at our local church where a person who was unvaccinated was actually giving out the Holy Eucharist. So, I mean, knowingly unvaccinated, giving out the Holy Eucharist. That's, I mean, you cannot guarantee that people are not going to come into a room, vaccinated or unvaccinated, and do what's right for others in the community. And I see no harm. There is absolutely no downside in a public event like what we're talking about right now to require people to wear masks. There is no downside. Now, if we were talking about perhaps businesses and, the impact on, restaurants and those types of things, yeah, I could see a debate there. There's probably a good, healthy debate, no pun intended, on having that discussion. When we're talking about a volleyball game or a public hearing or something like that, there's no downside. So I just don't understand why the resistance.
Go ahead.
I respectfully disagree. I think the downside is you're taking away people's freedom. And I think that's a huge downside, personally, from my side. So that answer that. Just one other thing that I think, Dr. Ehrlich, you had said it earlier, too. I think it was, I'll paraphrase and correct me if I go wrong, but back to, I think, something Patrick said early on, the CDC is looking at things by county, not by towns. And I think, so your numbers, I don't disagree with the numbers, but I think as we're talking here, looking at our numbers and even the surrounding communities is really important, because 52% versus 89% in Westborough is vastly different. And I think we look at what we have here, knowing that, yes, there are people that are coming into town offices and whatever, but the vast majority of people in this town, the vast majority that will be coming to public meetings, town meetings, are going to be vaccinated people. I agree with Select Board Member Marshall that it does feel like Groundhog Day, but I think, just as the school said, I think we want to see what the numbers look like. And if we see upticks like we did before in this 7 to 14 and all of a sudden we're at 50, then I think we all get back together and say, you know, what's going on here? We're going to listen to you. Just as Amber said, we look to you guys as medical experts here and the roles that you and the board play. I mean, but I think at this point in time, I feel comfortable with where a couple of my board members were, and I think, but we think keep watching the numbers, and we may make changes going forward. But at this point, I think going with the method that we talked about, and I do think if the signs aren't there as they were before, I think we ask that we put signs back on the doors of the public buildings, asking people that if you're not unvaccinated, please wear a mask.
Vaccinated.
Unvaccinated.
If you
And-
are unvaccinated.
If you're unvaccinated, sorry, please wear, I don't say we recommend, I just say, if you're unvaccinated, please wear a mask.
I have a sign on my office door for my business, which says, no vax, please wear a mask, you know, with a cute little graphic, right? And it works well. The FedEx, we have 2 different FedEx delivery guys. One comes in, puts on a mask before he does, the other one doesn't. I agree with, you know, not to belabor, I agree that I don't think we need to change the guidance right now. Obviously, signage reminders. We also have the flexibility of that if there's a specific department or area of a town building for staff that, you know, feel the need, plexiglass dividers can go up. We're not telling people they can't mask or they shouldn't mask if you know, they feel that's appropriate. Under the current guidance, we have a pretty good sense of how empty or crowded our meetings are based on the
Usually
agenda
empty.
and the amount of communication we have. You know, for specific events like fall town meeting coming up, we can certainly step back and say, okay, this is going to be a large gathering. How do we foster engagement? How do we make it work for that event? We can make a decision about masks or not. I look at some of the items on our agenda for the select board meeting for the 24th. We know we're going to have a number of people in here. I see no problem with when we post the agenda, we request, we respectfully request that you wear a mask given the anticipated attendance, right? And so we can handle specific events indoor events that could pose an issue in a way without setting a generic policy and then continue to monitor. I think we look at hospitalizations, we look at the R factor, we look at number of cases, and if we start going above 1 and it's spread, then we can always reassess.
Melissa, do you guys have comments?
I mean, I agree with, town meetings, especially big town meetings. I would think that we should recommend masking depending on, I don't know the numbers that we typically get at certain meetings, but I think that would be a good idea. One thing that came up that Shelby mentioned was town staff vaccination, getting that data and how the superintendent is doing that with teachers. And I think that's really important information to get. Our town staff should feel comfortable coming to work. And if they know that the person sitting in the cubicle next to them is not vaccinated and not wearing a mask, I think that can be very difficult for people. And so, what do we do with that information is the next step. But I think that's information that we should get as a town. But, sorry.
And do you have any comments, Alan, on this?
Just one, which is a response to there's no downside to wearing masks. And that may be true for you, but I don't view it strictly in terms of the issue about personal freedom that Ian had raised. I know for myself, when I'm seeing patients, I have to wear a mask the whole time. Whenever I'm in the clinical building, I'm wearing a mask 100%. And especially when I'm engaged in patient care, the mask is irritating to me over time, and I start coughing. And I cough much more in a patient's room because I'm wearing a mask than I would if I was, just without that. And it makes me, I'm embarrassed at times. I have some mild asthma, and, this is just part of things. Other people have complained, and typically not with the type of mask you're wearing, but with other types of masks, that it can cause headaches from the pressure of the elastic and things like that. So there are nothing is entirely benign. Whether those types of considerations outweigh the concerns you have, that's a completely different story. But I just don't want it said that there's no downside, because there's always unintended or unexpected aspects to things.
Sure, sure. So if I make comment, I just want to make sure I clarify something. I am not suggesting mandating masks today, currently. I think that what people have discussed here today is an appropriate remedy for the near term. I am concerned that with the uptick we're seeing and the predictions that we saw last, summer going into the fall, and what we're seeing as the predictions for this summer going into the fall, we're already seeing that uptrend. I think all I'm suggesting is we need not be afraid to make that hard decision in regards to mandating safety and, measures for our community. And I'll also say that I'm very proud of the fact that Westborough has such a high vaccination rate. I mean, that's fantastic. I think we're a model for many other areas, and I'm talking to people, I know people in town who are not vaccinated. I'm constantly on them saying, you really should be. So just wanted to make sure I was clear on my current thinking and position right now, so that when the board does convene at some point, if we discuss this, folks understand it.
So, Christy, go ahead.
Thank you. I just wanted to go back to what was said about public meetings and requiring masking. If we think that the attendance is going to be high, I think that that's probably easier said than done. I think, referring to our August 24th meeting with the select board, I think that one, we are clear that that's going to be a large meeting, and so maybe we require masking, but I think in terms of giving guidance to other boards and committees, we need to be clear about what we're talking about in terms of numbers. So it's sort of difficult to say to all the many boards and committees, if you think you're going to have a big item, require masking. If people are looking for something more specific, if there's going to be a requirement. If you just are making a recommendation, that's a little bit easier.
Yeah, so I think that I had thrown out one set of numbers that were pretty arbitrary, but that was at least specific from that sense, and that if it was, a meeting that was more than 20 people or 20% of the capacity of the room, that's about where I start to feel it. If other members, though, of the Board of Health aren't comfortable with a specific recommendation, then, we can not make a specific requirement, but just make it a personal recommendation to people that if you're in a crowded situation, please wear a mask. So I think that either of those two options I'd be willing to entertain.
I prefer the more general guidance. I don't think there's any basis for arriving at a percentage. And, there are many factors that go into it, as you all know, not just the capacity of the room, which may deal with square footage, but also volume of the room and how much air is recirculating or not. So,
and are there any events that are really large that are coming up? I know in the past, like we've had certain groups that had tried to pull permits to have, large mass gatherings and stuff like that, even if they were outdoors. That's the sort of thing that, I'd like to tackle before people put the permits in.
So we already have some permits out. A lot of permits come in for September. We have one in August. We have the block party, which was supposed to be in July, was moved to Friday the 20th, 21st. I'm not sure the exact date.
27th.
27th.
There we go. So they were looking for guidance from the Board of Health also. It's a large gathering. It is outdoors. It is on Bay State, but it is town property. So that is one of the things that was on the list that was sent out today, and I gave to you at the beginning of the meeting. It's just, we're looking for some guidance on that. Right now, the CDC isn't recommending anything for outdoor gatherings, and this is something that was brought to us. We do have a few coming up, We do have the barbecue was canceled. That was supposed to be in early October. Going to be run by the not the chamber, but Rotary. Thank you. And they had a couple restaurants that were going to help out with that, and they have since pushed it off again. They're looking for the spring. So I think that's what they're looking for tonight, is looking for some kind of guidance if we're going to do something like that, so places know, especially the ones that are using town property. Now, we have some big events coming at the hotel and everything like that. Right now, there's no guidance for private businesses, so we don't want to get involved in that. We're just talking about large events on town property.
Any thoughts?
You know, it's outdoors, you know, we're having our kids outdoors at recess unmasked. I think at this stage with the numbers so low that we shouldn't recommend masking for an outdoor event.
I agree, and again, you'll have people who undoubtedly will be wearing masks, and that's fine. But I don't think it needs to be mandated based on what we know about transmission outdoors and our current degree of COVID cases in town.
So I think right now, if I were to sum up the guidance from the Board of Health, it sounds like the CDC guidance is pretty much in line with where we are. I think that, as you've heard, that we're evaluating the data as it comes in with our specific location in mind, and that if things here in Westborough change, I would expect that the Board of Health's position on this would change.
Sure.
So I think that, you know, now that we've had this groundwork laid, I think it'll actually be much quicker next time. When we do have another meeting or you want guidance, it will happen a little bit quicker. We don't get to meet to discuss these things very often, and we're not allowed to discuss our own opinions with each other until these meetings. And so we tend to use these meetings to sound each other out and to figure out where our own board is at. And so you're hearing this live in person, which is why it takes so long. So I apologize to you guys that, you know, it took this long to get here, but I think it's a very rationed approach that we're taking, and we are looking at all of the data. Go ahead.
Yeah, I think, absolutely agree. I think everything you said there was spot on. I guess one thing I just want to add, just thinking about as Ray was talking about the permits that come in, I think that's a great factor. So a meeting like this or a selectmen's meeting, you know, it's tough to tell how many people show up. Sometimes we think there's going to be a lot of people, and it's a ghost town. Sometimes we don't think it's anything controversial, and we get more people. I think we have to be cognizant and flexible with that. And if we see large crowds, then I think, you know, masking is probably appropriate. I do think, though, when we're talking events, anybody that wants to use a town property or a town building for a event that's not a meeting like this has to pull a permit. It's going to come through the office there, and I would think that would come, look to that to come to
Yep.
you as a board to make that decision as appropriate as things, you know, progress forward. And that way, I think, gets it ahead of time as well, ahead of the event, because they need to pull that permit with ample time for
Yeah,
it to be
that permit
evaluated.
goes through the select board's office and our office. We just do the food trucks, but the permit itself, I believe, gets set up by the select board's office. They have to approve the property.
So it gets back to Groundhog Day. It's probably meetings that we have
Yep.
requested you guys
Exactly.
participate in part of our meeting, just, which is fine. I think that's a really good way to, you know, we've talked before about, again, as our hope was things got better, that increased use of the beautiful Great Hall across the street. But that is, you know, something that we're going to have to monitor closely and figure out as we move this forward. But I think that's something we should do as a group.
Good. We're good. One comment over here. Hold on, Christy, just one sec.
Sorry. Yeah, I think just one comment, and that is that I think that was a great example of was it the barbecue and the Rotary Club postponing that, and it's an excellent example of the personal responsibility we talked about, and them moving that forward and not sort of taking those risks on. I agree with what my other board members have said this evening, and I think for me, it's just sort of probably enhanced monitoring for the foreseeable future, and if we see any changes that we would then want to be able to react to those and get together again as a group. So, thank you very much. I enjoyed this discussion tonight.
And Christy, you had something you wanted to say?
holding events indoors come to the Board of Health on a case-by-case basis, or any permit, including outdoor events at this point?
So I think that it's not that any event, but I think that those events that are occurring or want to occur that seem risky. And I think there's a little bit of a judgment call that we're empowering the Board of Selectmen, that if you are getting a permit for something that, really has little chance for risk, I'm not sure that we need to evaluate it as a Board of Health. But those events that, could potentially be risky, we'd prefer to be involved and at least be notified of this. And especially those events where there's no food involved that we might not otherwise hear about. If you think that there's a chance that it might be risky, then it's probably worth notifying us.
But I think we did hear, though, that outdoor events at this point in time was comfortable.
Yep.
So it really would be indoor events, outdoor events, again, at this point, are comfortable.
Yeah, I agree, and honestly, the main indoor event that is going to come up in the relatively near future would be the fall town meeting, and I expect that you're going to be talking to us about that anyhow.
Yes.
We love to.
Yeah.
So
And we want the town moderator for that, because
Yeah,
that's
exactly.
I just want to point out, there was something that came up earlier, but I think it kind of got overshadowed by everything else. The senior center having their cooking outside, 70 to 75 seniors inside eating. I think that's one that comes up in a week and a half, 2 weeks. So I think
Why
that's
can't
when
they eat? They can't eat outside.
they don't want to eat outside. They like the air conditioning.
But they also don't want to eat outside because of the bugs, and so they do it in the evening. They've already capped the attendance at less than half the capacity of the room, and so that event's on the August 20th. It's planned for August 24th.
Yeah, so I think this is one that kind of splits that difference in terms of what they're doing. There's food involved. People need to be able to eat if they're at the event, and the event's going to go forward. And so are there things that we can do to, give them advice on how to do it more safely? And, I think that some of the suggestions that they should consider, it sounds like they have, like, can they eat outdoors? For the portion of the time that they're not eating, that they could be wearing masks. That would, be one thing that we could recommend that if they wanted to do. And the other thing is there a strong feeling that the event that they have structured, the way they have structured, is this something that we're against the way it's structured? Or are we fine with this proceeding?
How many people did you say? 70?
It's capped at 75.
It's capped at 75.
Up to 75. And I'm assuming it's not limited to vaccinated only seniors?
No.
Right?
No.
Are these all Westborough people or not?
It's through the Westborough Senior Center. I
Yeah.
believe it's just the Westborough residents.
It's predominantly.
There could
Because,
be
I mean,
others.
Yeah.
the vaccination rate amongst seniors in Westborough is
Very high.
exceedingly high.
See, yeah.
Yes.
Yep. No, I mean, I would just say if the number, if we're seeing more cases in the community before then, obviously it's coming up pretty quickly, but we might want to revisit that. There's such a high-risk population. And certainly the people who are getting sick from Delta tend to be higher risk people. So, I think it just needs to be something to think about as we look at the numbers over the next week or two. If the numbers are really climbing, it might be something that shouldn't happen.
Yeah, I mean, I think that one of the things that, actually, I was going to point to Shelby, that said is about personal responsibility and, people taking, individual decisions and living with their own consequences. I think that these people that are attending the pancake breakfast are the same people that had been isolated for quite a while and are looking forward to some social interaction and are very much doing those risk calculations in their head themselves. I don't think that this is a group of people that have no idea about coronavirus. I think these are the people that have very much aware of it. And so I guess I'm more inclined in this particular case with it being, older adults that are making these choices, that they're making the choices about their own lives. And, I think that if we provide them some, nice recommendations, I think that, wearing a mask when you're not eating is probably a good recommendation. And, I don't think it's a requirement, but that's, I think, the point where I'd feel comfortable.
So,
Shelby,
can I,
did you wanna-
yeah, so a couple things. So I think it is an extremely responsible group. highly vaccinated percentage. I think at some point when we talked about, risks to teaching children in those formative years, the isolation effect on our seniors in some I mean, there's nothing worse than death. So I don't want to compare it to that, but it has been devastating to people. I've witnessed it firsthand. And so I also think there's a practical element of communicating to seniors, to this group very clearly, what is the expectation, excuse me. I think our senior center director and team have been very responsible with a very measured reopening of the senior center. And so I recommend that our two bodies here give clear guidance tonight, because just the practical communication, not everyone uses email, so it's not like 2 days before, hey, everyone bring a mask. So if that is, and maybe that's it. Bring a mask in case it's crowded, and we encourage you to put it on, but you're not required to, or something like, but I would absolutely be opposed to any thought about canceling that event. Again, with the caveat that if we saw some dramatic spike, then obviously all bets are off and we're in a different conversation.
Shelby, I'll make sure I put masks up there. I'll send a couple boxes of masks up there. I would talk to Jim Stewart, and we're gonna be putting them at the doors of all the buildings too, so when people go in. That way, with the signs on the wall that says, wear a mask or whatever, we're gonna make sure there's there for people to grab.
Terrific.
Great.
Yeah, I would just echo a lot of what Shelby just said. That community definitely needs to be together, and I'm glad to hear that there's an accommodation with a reduction of size, but I would strongly recommend that we allow that event to go forward because it is so important to that community, and I think that they are very responsible in regards to how they deal with this. So.
I would just add, because it hasn't come up, is that the fire department is actually the group that puts on this event for the seniors. So I know that the fire chief is watching this meeting for your guidance.
Well, I think that was the guidance that I think the Board of Health and the Select Board are agreeing on. If there's any objections to that sort of, guidance, speak up. Otherwise, I'll presume that it speaks for everybody here. Good. I don't think there's anything else on the agenda for the dual board function. I think there are a few items left for our Board of Health in terms of just other business, and we can decide whether we want to tackle that tonight or whether we want to push that off to a different meeting. Was there anything else that the Select Board wanted to discuss?
Just one email not related to COVID-19, but a public service announcement related to the expected extreme heat conditions coming later this week. I do, since I know folks might be watching this, residents are urged to monitor the latest forecasts and warning issued by the National Weather Service. Specifically, residents should drink plenty of fluids, remain in air conditioning, limit times outdoors in the sun, and are urged to check up on relatives and neighbors. The Westborough Public Library and Senior Center will be open extended hours starting tomorrow, Wednesday through Friday, and anyone seeking relief from the heat is welcome to either of these cooling centers. The library, located at 55 West Main Street, will be open from 9 a.m. to 7 p.m. on Wednesday and Thursday, and 9 a.m. to 5 p.m. on Friday. The Senior Center, located at 4 Rogers Road, will be open from 8 a.m. to 6 p.m. this Wednesday, Thursday, and Friday. The fire chief has also shared this information via the Code Red notification system and social media. And so I will entertain a motion from the Select Board to adjourn.
So moved.
And second?
Second.
All in favor? The Select Board is adjourned. Thank you.
Thank you for coming.
Thank you very
tonight.
much.
We really appreciate it.
No, we appreciate it too. Thank you.
Thank you.
Thank you.
Okay. Okay, that's fine. We're going to take a brief pause while the Select Board steps out, and then we'll decide whether we are wrapping up. Do you have a feeling whether you want to wrap up soon, or whether you want to just run through the rest of the issues?
There wasn't that much.
Yeah, we can just
It's
check.
up to you.
we
It's
can
totally
raise
up to
it
you.
and see
Yeah.
if there's any directors issues that are real important. So-
Absolutely.
Okay.
No, that's great. Thank you.
So we're making the decision whether we should keep going, press through, at least hear whether there's any major directors' issues, and, you know, I think there's only a few things
I
left on the
think it'll take
agenda.
us 5-10 minutes, and I feel really bad if we were to skip over Maria's report, you know?
I know, I was gonna say, I was
She works so hard on it every month.
love her little comments.
So then, yeah, the next item on the agenda is the health inspector's report for July 2021. Let's see, I had a question about the Chengdu. They had a number of issues, and you were going to go do a reinspection. I was wondering if that reinspection has happened and whether they were able to complete all the stuff on your list.
Yes, I did go into a reinspection and all violations were corrected.
Good.
They went above and beyond, actually.
That's nice to hear. And the other thing I wanted to make a comment on was the number of items in your personal development section was quite extensive, so I'm glad that all of that happened, and surprised that you found time to actually do the inspections.
Yeah, I want to thank her for getting the health inspector training on the housing, because now I can split the housing. I don't have to do it all myself.
So in order to get the housing, I had to do all those
the other
trainings.
Well, it's quite extensive, and we did notice.
Thank you.
Did you guys have any other questions about this?
Not,
I move we accept the health inspector's report for July 2021.
I second it.
All in favor?
Aye.
Aye. Let's see, I've lost my agenda.
I think
There
I'm
we go.
next.
You want to-
Okay, interim director's issues then.
Okay, so I'm gonna be quick, we don't have a lot. Binax Now has been made available to local towns. I talked to the fire chief because he does the testing right now for employees. So we are looking into that. I put our name in, I don't know if we'll get it, but I put it in. It's an AG test, not a PCR, so it is a little different, but the fire chief said he would be able to do town employees, but we don't have the staffing to do all residents. We'd have to have a full clinic to be able to do that. So I think we're gonna do it in stages. We'll start with town employees and then see where we go. We're only gonna get a public health nurse like 14 to 16 hours a week out of our, the group that we joined. And I don't think that would be the best use of her time, is to just be doing testing. I think we could use her doing contact tracing and everything like that. But I'll be working with the new director on that, and then we'll see what we can do with the Binax Now as it moves forward, and go from there. The contact tracing grant that the new director put us into is on hold right now. We should hear something in the next week or so. The reason it's on hold, they were putting money aside for towns to use for contact tracing. They're trying to rehire the CTC. So if they bring back the CTC, they're not gonna give us money for contact tracing because we can use the CTC. Warrant articles for the town meeting are due on August 20th. We don't have anything right now. I did speak to the new director, and we are looking at nuisance property ones because we've had those. You saw in my report, we've had a couple, and we've had a few in the past. We're gonna look to put something in like that in on March, at the March meeting. Cooling centers, the fire chief, I had Alan Edinburgh read that from the fire chief. Beach tests are done. Yesterday was my last day. We had no exceedance over 8 parts per million. Last year, we had 1,200, 250, 600. This year, all the numbers were straight and even. I think I had one test was at 8, all the others were under 5. So we were really good this year at the beach.
And as far as the beach, the algae problems that we've
Algae
had in the
problems,
past, do we
have
treat,
not
we
had-
did do the treatment this year, right?
We actually,
Or did we postpone
I'd have
that?
to talk with Jennifer. I don't think the treatment got done yet. There was a backup on it or something. Jen, I know she was watching it. She might be done watching it now, but there was some backups on some of the weed control didn't get done, and I don't believe they started the
Copper sulfate or
the
whatever
copper
it was.
sulfate, yes. I think that's gonna start in the next month, and we're gonna be posting the lake then.
Because we've had trouble with the algae in the fall, or like
Yes.
September.
In the past, it was September and October that Steve and I found it. The last 2 summers were kind of anomaly. We were getting them in June and we got some in July and August, but normally, like Dr. Ehrlich said, it's been September and October we get those. So we're still gonna be checking for that. I'm still gonna be taking rides down the lake, kind of like I'm going to the beach or something, just hang out at the beach and check that. I just got our allotment for juvenile flu vaccine. We got 80 doses this year. In the past, we were only doing 70 to 80 doses. Last year, they sent us 200. We used 80 doses, and we'll get 80 doses for the juvenile vaccine again. And those, we usually run that in November. So, and we use one of the schools, usually Mill Pond. So I will be working with Amber and the school department to set up that date and find a date that works for everybody.
I heard something about the color program for tracking vaccinations and stuff like that. Have you heard about that from the state? I think it's...
Yes, so we used the color program, and Maria she used it more than I did at the vaccine clinics. Color was they used to have PrepMod, and PrepMod, the state got rid of PrepMod and started with color. We don't have our own account with color. We used it through I have an email address, and Maria does too, that we could use color on. We don't have our own account through the town. I have to look into that and see what we need in order to follow up on some of that information. And the information they tell you on color isn't 100% either. We do pretty well with the state numbers and our own numbers, but we will, I have been looking into that. I did get the emails on that too.
Yeah.
And I believe that is it. I did introduce everybody to Jennifer, who will be starting on the 23rd. And at that point, I will be stepping down from my duties, which I am not all too upset about. You can still email me questions, and I'll give them to Jennifer until she has an email address.
Thank you very much for
I'd like-
what you've done.
I'd like to make a motion.
You have the floor.
I move that the Board of Health commend Ray Gothier on his service as interim director, his dedication and diligence during this time of a special need was greatly appreciated, and we thank him tremendously for all that he has done on behalf of the town. And I would like this sent to town manager.
I'll make a second on that motion. All in favor?
Thank you. Yeah, thanks.
No, we do appreciate everything you've put in. We know it's above and beyond what is normally required of a sanitarian,
Yeah,
and we are appreciative.
I didn't realize how much we relied on Steve until I took over the position. And now I know why I didn't go for the position. Shh, welcome, Jen. Oh, she's been a director. She knows it all. I've never been a director, and I never want to be a director. So I like to be on the road doing inspections. That's my job. I can't sit behind the desk. I gain weight.
So I do think we have to plan a date for the September meeting. I think the third Tuesday is the 21st.
Yep. Oh, and we are going to be trying to get this room from now on because they want us on TV. So they wanted the things videotaped. So Christy is going to make sure we get a room that Westborough TV can tape us on.
I think that for the near future, I think that is a good idea.
So September 21st is the third Tuesday?
Yep. Does anyone have
Just
problems with it?
I'm just double checking that it's fine with me.
I don't see a problem.
And we may have a joint meeting before that. I think that the school department was looking to try to get in touch with us, and, possibly if numbers change, we may have throw an emergency meeting on the calendar.
So the school department meets next week on the 17th. I will be on vacation. You may get invited to that. 24th, I believe you've already been invited to the select board meeting. It's whether or not you want to go and if the numbers are where you want them to be. But we have been invited to that meeting too.
Great.
So there are a lot
I'm
of
fine with
meetings coming
21st.
up.
Okay, so let's plan
At the
on,
same time, 5:30?
Yeah.
I think, so. Yeah, our meeting would be 5:30. I think that
Right,
the
no,
select
the
board would
select,
also.
yeah.
We can double check and take that offline.
Mhm.
So yeah, I think with the next meeting being the 21st of September, and would be our own meeting, and then a joint meeting that would be sooner than that, that would be the 24th of this month.
Yeah.
Good.
Make a motion, we adjourn?
I second it.
All in favor?
Aye.
Aye. Thank you, Westborough TV.